Mengawali kegiatan kita pada pagi hari ini, marilah kita bersama-sama menyanyikan lagu kebangsaan Indonesia Raya. Hadirin dimohon berdiri. Hadirin disilakan duduk kembali. Assalamualaikum warahmatullahi wabarakatuh. Yang terhormat, Asisten 1 Pemerintahan dan Kesejahteraan Rakyat Sekretaris Daerah Provinsi Jawa Timur, Bapak DRS Beni Sampirwanto MSI. Yang kami hormati, Kepala Bidang Pembinaan Pendidikan Khusus dan Pendidikan Layanan Khusus Dinas Pendidikan Provinsi Jawa Timur, Ibu Iva Cadrani Tias SOS MAB. Yang kami hormati, Kepala Bidang Pengembangan Pengajaran Kompetensi BPSDM Provinsi Jawa Timur, Bapak Heru Saleh SE. Di Jawa Timur, Ibu Margareta. And we would like guests for this morning and speakers also for our master training, Ibu Joan Ibu Kate Lazuan. Selamat datang ke pengembangan sumber daya manusia kita Allah Tuhan yang Maha Kuasa, karena atas segala limpahan rahmat, berkah, hidayah, serta inayahnya semata, kita dapat berkumpul bersama dalam keadaan sehat walafiat untuk mengikuti seluruh rangkaian kegiatan kita pada kesempatan kali ini. Bapak Ibu hadirin yang kami hormati, tanpa mengurangi rasa hormat, kami mohon perkenan Bapak Asisten untuk memberikan sambutan serta pengarahan dan sekaligus berkenan untuk membuka kegiatan Masterclass Training Autism pada kesempatan kali ini. Yang terhormat Bapak DRS Beni Sampirwanto MSI, disilahkan.
Saya tadi melihat kok tegang sekali ya. Saya noleh ke Bu Reta, sangat tegang begitu ya. Gitu ya Bu. Bu John, just now I take a look our faces, and then Bu Reta, it seems, what do you call it? Nervous. Yeah. What happened? Why she is nervous? Okay, that is why not to make you nervous, I make a pantun. Bu John, pantun is a special poet from Indonesia. Usually, there is a special pattern to make that. The final word should be the same, etc. The content beautiful. That is why usually we laugh and then also clap our hand. And then I also inform to my colleague, if we smile, clap our hands, and then our age will be minimum 5 years than our age. Ya, ya. Jadi gitu ya, kalau semoga ini Joko Sembung, semoga nyambung, supaya Bu Reta tidak dan yang lain tidak tegang. Gitu. Buah labu, buah tomat dijadikan adonan untuk semur. Perbaikan masterclass training 24, dorong layanan autisme terbaik di Jawa Timur. Terima kasih. Anu ya, Joko Sembung ya, nyambung ya. I make confirmation, either my pantun is related between the line or not, and then our colleague agree that it is nyambung, it is related each other. uh, Assalamualaikum warahmatullahi wabarakatuh. Salam Om Swastiastu, Namo Buddhaya, Salam Kebajikan Rahayu. Distinguished CEO AAWA, Ibu Joanne McNager, and colleagues attending here, accompanying her, Bukit, Meskit. Jadi teman-teman yang belum pernah ke luar negeri, di dunia barat itu ada beda antara Miss dan Mrs. dan Mas. Kalau Mas itu lawannya Mister. Jadi kalau kita belum tahu itu apakah bujangan apa sudah berkeluarga, kita manggilnya Mas. Jadi I address Meskit gitu ya. And then also Bu Gris, ya Bu Gris. Distinguished Bu Reta, Ketua Forum Peduli Autisme Jawa Timur. Ini bahasa Inggrisnya Chairwoman of East Java Forum of Autism Concern. Is it right? Oh, Autism Care. And then also the Director of related agencies in East Java, who are now representative, namely Bu Iva, as Deputy Director in charge of special needs, and then also Pak Heru as Deputy Director of Human Resources. Hadirin sekalian, ini langsung bahasa Inggris saja ya untuk menyingkat waktu ya. First of all, let us glorify God with the grace given to us so we can attend this important meeting, namely masterclass training. On behalf of the East Java Provincial Government, I welcome you, Ms. Joan, the CEO of AAWA in East Java, the second hometown of Ms. Joan. Last night, Ms. Joan told us that it's her second hometown. It means that the people and then also the food and the environment is fitted with her. Is it right? That is why I write down East Java is the second hometown of Ms. Joanne in my heart and then also in my diary. Ya, ya saya catat ini ya, ya. So we are very happy, Bu John. So you feel this is, we feel very happy if you think this province, the people, the food, the environment is fitted with you. I hope in the future, Meskit and then also Mas Chris also will have the same feeling as Bu John. Ya gitu ya. Kalau Bu Josephine sudah karena orang sini ya ya. Ladies and gentlemen, the involvement or engagement of AAWA to East Java has already give much contribution to us. Started by training 21 person from East Java to WA. They are health practitioner, health actor, and then also autism actor. The interns or the trainees already contribute or already distribute, already share their knowledge to most people here. So we are very happy. So their sharing is fitted with the main purpose why at the time we give training we cooperate with Ibu Joan to train the trainees, the interns. East Java Provincial Government welcome and give high appreciation, Bu Joan, for your plan, for your activity to give masterclass training and seminar overcoming barriers autistic individual, assessing medical and dental services. I think this is also important. If, for example, there is a child and then getting an autistic child and then getting a problem with a dental problem, and then we cannot intervene well, serve well, and then we poor the child, I think. So I think what already done by Bu Jen and Bu John and colleague is very, very beneficial for this province, for the people and the government of this province. For the participant, I hope you will follow seriously this training, because with your competency got from this training, you will give better service to the children with disability, to the children, the people with autism. I think it is my speech. So I suffice my speech. My speech. Tuku punten nek Solo cukup semanten atur kawulo. Itu ya. So it is in Japanese, Bu John. It is a Japanese language. I suffice my speech, and then by going to Solo is a city in which our president, Mr. Jokowi, coming from. Okay, thank you. May have a nice training, and once again, on behalf of the government, the East Java provincial government, please be serious, because your seriousness will give better service to children with disability here in East Java. Thank you. Okay.
J, baik Bapak Ibu, demikianlah rangkaian kegiatan untuk pembukaan Masterclass Scanning kali ini. Namun sebelum meninggalkan tempat, Bapak mohon izin berkenan untuk berfoto bersama terlebih dahulu dengan seluruh peserta. Baik. Untuk selanjutnya mohon izin Bapak Asisten, ada sedikit gift yang akan diberikan Bu Joan kepada Bapak. Kami ucapkan terima kasih atas perkenan kehadiran Bapak Asisten pada kesempatan kali ini. Selamat melanjutkan tugas di tempat selanjutnya.
So you all have to relax this morning and get prepared to work, right? You're gonna
Yes. Yeah.
I was just sitting on my nice chair. Sorry, Joanne, can you
Yeah,
repeat
so
that again?
I want everyone to relax.
Yeah,
and get.
I told them that.
Yeah, and
Relax saja Ibu dan Bapak, kita dui bahasa yang udah ngerti bisa cepat, tapi jangan khawatir ada bahasa Indonesianya. Yes, Joanne.
so I'll just tell you a little bit about the Autism Association for those of you who don't know. We're one of the largest specialist organizations for autism in Australia.
Jadi Autism Association of Western Australia adalah organisasi layanan terbesar di Australia khusus tentang autisme.
We provide services from early intervention when children are just 2 years old, right through the whole lifespan.
Layanan yang diberikan dari anak mulai umur sekitar 2 tahun hingga dewasa akhir atau sepanjang masa perkembangan.
Yeah, we provide early intervention, school age services, community participation services, residential services, diagnostic services, and a whole range of others, and family support, parent support.
Dan diberikan layanan dari proses intervensi dini, diagnosa, layanan residensial, layanan orang dewasa, dan banyak services layanan lainnya.
So we have over 1,000 employees, and they are clinical psychologists, speech pathologists, occupational therapists, social workers, nurses, and we have a small team that includes a psychiatrist.
Jadi tim yang ada di sini juga multidisipliner ya, dari psikolog, dari speech therapist, pathologist, dan juga ada psikiater dan I'm not but please continue. Yeah.
Everyone.
I think they get the point.
But the most important person on the team is the family.
Yeah.
The most important person on the team is the family,
Tapi kuncinya adalah keluarga
or the person who is actually caring for that person.
atau yang merawat anak.
Because in the lifetime of a person with a disability, professionals will come and go, but the family is there forever.
Karena profesional terapis bisa datang dan pergi berganti, tapi orang tua tetap sama anak.
So a really important part of the work of any professional is to build family capacity.
Jadi tugas utama seorang profesional yang bekerja dengan anak autistik adalah bekerja sama orang tua dan keluarganya.
So the work that we do as professionals should empower others, empower schools, empower people in the community to support the person with autism, empower the family. So therapy isn't just something you do in a clinic. What happens in the clinic is a catalyst for intervention right across the person's life.
Jadi terapi harus memberdayakan baik orang tua, sekolah, komunitas, dan juga keluarga. Karena ini supaya menjadi kunci agar perubahan terjadi di semua bagian.
So we started off here in 2011, did our first workshop, I think, in 2013. And we started with early childhood learning.
Pada tahun 2013, kegiatan ini sudah dimulai dan itu dimulai dengan intervensi dini.
And really through the great support we got from Java government, especially Pac Benny, we were able to basically be the seed that created the forum that you now have that's doing great work here in East Java.
Diawali dengan kerjasama yang sangat dibantu oleh Pak Beni yang tadi membuka, asisten sekda, dan ini sudah membuahkan berbagai program termasuk Forum Peduli Autisme Jawa Timur yang membuka juga banyak kegiatan.
But children with autism grow into be adults with autism. And that's really a lot of the focus that we're going to be doing other than today is going to be looking at the needs of adults.
Yeah.
Not today, but from the rest of the week.
2013 kami mulai dengan anak-anak, tapi anak-anak akan berkembang menjadi dewasa. Maka tugas yang akan dipersiapkan adalah mendampingi mereka hingga menuju perkembangannya.
So Kate will take us back to looking at some really important tools in working with children with autism.
Kate nanti akan membawa kita memahami dari karakteristik awal yang nanti akan bisa digunakan untuk mendampingi anak dengan autisme.
But Kate's presentation will go beyond an academic presentation of a screening and assessment. It will take us into how you use that how you use the results that you get to program for the child.
Presentasi Kate nanti bukan hanya sekedar akademik ya atau ilmu, tapi bagaimana sungguh-sungguh menggunakan hasil assessment untuk membantu anak mengoptimalkan perkembangannya.
If you want to take an assessment or screening, but don't go on to look at strategies for how you make the child's life better, there's really no point in doing assessment.
Karena kalau kita menggunakan assessment hanya untuk mendapat label tanpa memahami bagaimana menerjemahkan itu menjadi terapi yang sungguh-sungguh dibutuhkan anak, tidak ada gunanya assessment.
So today, Kate will go through assessment to programming to making that programming functional in everyday life.
Jadi Kate akan membawa kita memahami dari proses assessment, pembuatan assessment ini menjadi satu kegiatan intervensi yang intervensi harus fungsional.
Because intervention is much, much more than sitting at a tabletop with a child. Intervention is how you build those intervention goals into the child's everyday experience of life.
Karena intervensi tidak boleh hanya berada di atas meja kerja one and one dengan anak, tapi ini harus benar-benar masuk dan relevan bagi kehidupan anak.
So, in addition to going from assessment to programming, Kate will also look at the involvement of parents.
Nanti Kate akan menunjukkan bagaimana dari proses assessment, pembuatan program akan selalu melibatkan orang tua.
And I think the empowerment of parents is one of the most critical determiners of success in intervention.
Dan perlu dipahami bahwa pelibatan orang tua adalah kunci penting yang harus berada dalam intervensi kita.
So before I hand you over to Kate, I would just like to reiterate something Pak Benny said. I really do find, I think we've all found a really special place in our hearts for East Java. It is a wonderful place to work. It's been a great privilege to work here over the last decade, and we look forward to continuing that work. And we look forward to today, because I think we're going to have a lot of fun today apart from anything else.
Ya, Joan, teringat apa yang disampaikan Pak Benny bahwa sangat adalah kehormatan besar dan menyenangkan untuk bekerja dengan Jawa Timur selama ini, dan semoga ini juga menyenangkan buat kita semua. Yes, Joan. Thank you, Joan. Let's give applause for Joan. So, Ibu Kate.
Selamat pagi. Good morning. Good
Pagi.
morning. It is a pleasure to be here with you all today. We are going to work hard, we're going to learn, and we're going to have lots of fun, I hope, as well.
Ya, kita akan belajar bersama, bekerja keras, tapi juga bersenang-senang. Setuju?
Sound good. Excellent. This is my first time to Surabaya. It has been wonderful. I have learnt that Indonesians like to eat, and they like to eat lots of delicious food. And so we've really been welcomed so wonderfully with everybody's hospitality and such wonderful food. So thank you.
Jadi ini pertama kalinya Ibu Kate datang ke sini dan dia udah melihat bahwa kita suka makanan karena semuanya di mana-mana ada makanan. Tapi dia senang dan mudah-mudahan kita bisa belajar banyak dari Ibu Kate.
My background, I am a senior clinician that works at the Autism Association. I've been working there since 2008. And I've worked in various roles, predominantly in the early intervention team and helping with a lot of what we'll be talking to today. And recently, 2 years ago, I moved across into the adult services, and I'm now supporting the therapy and clinical services for adults over 18, which involves supporting complex needs and also positive behavior support.
Okay. I hope I can
Summarize.
remember that. Ibu Kate adalah klinisi senior di AAWA, sudah bekerja cukup lama, dimulai dari pusat layanan intervensi dini, tapi sekarang sudah pindah mendampingi orang-orang dewasa autistik, terutama yang membutuhkan bantuan dan dukungan lebih banyak, dan ini juga yang nanti akan relevan dengan materi kita. Yes, Kate.
Okay, so let's have a look at what we're doing today.
Oke, kita lihat apa yang akan kita lakukan hari ini.
So we will have some lunch, which I know is very important.
True. Kita akan ada break dan ada makan siang.
So to start off this morning, we will be talking about some screening tools. So I will walk you through some of the common screening tools that we can use both for development but also for autism.
Ya, kita akan mulai dengan memahami tentang alat screening yang bisa kita gunakan baik untuk autisme atau juga untuk perkembangan pada umumnya. Yes, Kate. Yes, we can share it now. Okay. Mohon bantuan Dina dan rekan-rekan untuk membagikan buklet yang sudah disediakan.
So we'll be handing around some booklets, and within that is what we call a workbook. And the workbook will be guiding us through the information that we're talking about today.
Jadi ini akan dibagikan buklet bagi Anda. Di dalamnya nanti ada panduan tentang assessment yang kita akan pelajari pada hari ini. Terima kasih. Saling membantu dan melayani rekan-rekannya. Sorry for this.
You can have I'm sure you will all be eager to find out what's in those. So I will talk through that now for you.
Anda sudah menerima, mohon dijaga ketenangannya. Silakan sambil dibaca, dipahami. Kate akan mendampingi kita memahami satu persatu. Can I have one, Dina? Thank you.
Okay. So in your workbook, in your folder, you will have a workbook that has the title Screening, Functional Assessment and Recommendations. That will guide us through the day today. So please, you are listening, and while you take notes, what you would like to do to help you understand the information.
Ya, Anda sudah diberikan buklet ini, digunakan untuk tempat catatan untuk belajar.
We will also be doing lots of different activities throughout the day. So information that you take down will.
Kita juga akan ada beberapa aktivitas, nanti ada masuk dalam berkelompok yang nanti ditujukan supaya pahami lebih dalam lagi materinya. Yes, Kate.
So don't worry, we will get to look at everything throughout the day. So no need to flip for now. It's just open.
Jangan khawatir, kita punya waktu untuk memahami satu persatu. Buka saja halaman 1, keluar lingkaran.
So I mentioned we'll be talking about screening this morning and looking at common screening tools. After our first break, we will be looking at functional assessment. What a good functional assessment? What are the considerations we need to make? And we'll have an opportunity to practice using what we learned this morning as well.
Ya, pagi ini kita akan belajar tentang assessment, tapi bagaimana membuat assessment ini memberi informasi yang fungsional, terapi yang fungsional. Ini akan dalam. Yes.
Then after lunch, we will have a look at the assessment that we've done. So we'll watch a video. How you transform that assessment into a program. So we'll look at some goal setting, we'll look at a program, and we'll look then at the recommendations.
Jadi kalau pagi ini kita sudah belajar, setelah kita bagaimana menggunakan hasil assessment untuk membuat program yang fungsional buat anak, dan juga bagaimana rekomendasi yang terkait dengan assessment tersebut. Yes, Kate?
Excellent. So relax and let's get ready.
Yeah, let's get.
So to start, I want to acknowledge the level of knowledge and expertise in the room. We've all come here with information about what we. So looking at the outside circle, we all know what we need to do. We know that we're here to the lives of young children with autism and people in general with autism. We know the information that we've got, and we know that there's some great policy in place to be transforming the lives of children with autism. Really what today is going to be about is transforming that information that we've got into looking at a little bit deeper. How do we use that information to program? How do we use that information so that the families that we're supporting really understand what we're doing?
Oke, jadi Kate menghargai bahwa kita semua ini kemungkinan sudah punya pengalaman bekerja dengan orang autistik. Kita membawa pemahaman kita, mengapa kita di sini. Dan juga ada beberapa kebijakan policy baik pada level daerah maupun nasional yang memang sudah memayungi kerja kita. Dan ini Kate sangat mengapresiasi ini dalam diskusi kita berikutnya.
And how do we share that information with the teachers too, so that the information is relevant for the child in the classroom?
Ya, kita juga memastikan informasi yang kita punya ini bukan cuma disimpan sendiri, tapi juga bisa dikomunikasikan sehingga pada guru di kelas maupun orang-orang yang terlibat dengan anak.
And we'll look at why we're doing it this way, the
Dan
most important part.
Ya, kita juga perlu paham kenapa sih kita melakukan dengan cara seperti itu.
Excellent, thank you. So I would like to get an idea of what I've said so far today, what you would really like to learn. By the end of the day, what is it that you have come here for? So I have some post-its. If everybody could get one, I would like everybody to do one. If you have more, that's great. Everybody could get one post-it and write on there. We'll spend 2 minutes, think about what you would like to learn from today.
Baik, Kate pengen tahu pada akhir hari ini, hari pertama, kita tuh pengen dapat apa? Tolong diambil satu kertas post-it. Oh, nggak dapat ya. Lalu tuliskan apa yang hendak Anda capai, ya. Nanti akan kita tempel di dinding gelas saja supaya Kalau mau pakai spidol monggo. Kalau enggak pakai pulpen juga bisa. They have pen, so they can also
So
write
if
down.
there's a specific piece of information that you would like today, you can write that down. If it's a broad area that I've discussed, that's fine too. So I want to make sure that I am giving you the information that will be helpful for you.
Yeah. Kate pengen tahu kita tuh pengen mencapai apa. Apakah suatu hal yang spesifik atau yang secara umum tentang assessment, tuliskan supaya dia bisa memenuhi harapannya sebagian dari keinginan kita tersebut. Jadi apa yang Anda ingin capai hari ini terkait dengan screening, assessment fungsional, dan rekomendasi bagi siswa dengan autisme. Satu menit ya, nggak usah bikin prosa, ya, yang sederhana saja bisa gampang dibaca. Ya, sudah? Kalau sudah, silahkan mulai ditempel. Mungkin yang sebelah sini bisa di sebelah sini, ya, yang sebelah sana bisa di sebelah sana, ya. Nempelnya yang memudahkan dibaca ya, nggak usah terlalu tinggi mungkin. Agak ke depan biar Kate gampang bacanya. Silahkan. Mbak, di sini Mbak, ke depan sini biar gampang bacanya nggih. Biar ada jalannya dikit katanya. Biar bergerak, movement. Come and move. Yes, move, bergerak, bergerak, bergerak. Nice. I'm going to read some of them. Do you want me to read some of them, Kate?
Pardon?
Do you want me to read some of them
No,
or later?
we'll have a look at morning tea and we'll group them into categories and we'll go through them throughout the day.
Baik, terima kasih yang sudah menempel. Nanti akan kita baca bersama-sama pada saat break dan kita akan mengelompokkan topik-topik yang sejenis. Ya, monggo. Bergerak, bergerak, bergerak.
Thank you, everybody. That was the first movement activity for the day. And
Terima
it was
kasih.
getting you to start thinking about your outcomes for the day as well. Okay, let's get started. So we'll be talking about what is the difference between screening and a formal diagnosis. Screening is a lot.
Oh, now? Oke. Kita akan mengenali apa perbedaan antara screening dan diagnostik.
Thank you. So screening is generally quicker and easier to administer. In general, it doesn't require training, although some tools require some element of training. But the idea is that a screening tool can be used by anybody, and it can be used as a guide to identify whether there are developmental delays or whether there might be characteristics of autism.
Ya, screening biasanya sifatnya lebih mudah untuk dilakukan dan bertanya tentang hal-hal yang mendasar. Tidak perlu yang melakukannya adalah seorang yang klinisi atau profesional klinis. Ya.
Whereas a diagnostic assessment is usually completed by a range of professionals who are specifically trained in doing autism assessment. And it usually takes a lot longer, and as a result, it can be more costly.
Ya, kalau diagnostik biasanya ini cukup lama, ya, dan ini dilakukan oleh berbagai profesi yang memang sudah spesialisasinya di dalam hal ini, dan karena prosesnya lama biasanya agak mahal.
So what's really important is for us today is to understand the screening tools. The screening tools have been researched to a high sensitivity that they are able to determine whether there is a likelihood of autism or not. And because they are much more easily accessible and because they are quicker to administer and can be administered by anybody within reason, and I'll go through each of those, the common tools, that is our focus for today.
Ya. Hari ini kita akan fokus kepada screening. Kenapa? Karena dengan kelebihan kemudahannya ini juga bisa memberikan informasi yang bisa dilanjutkan dengan diagnostik. Ya, dan ini juga memudahkan buat semua orang untuk mempelajarinya.
A screening tool is enough to provide us indication that a child can receive some support.
Sebuah screening bisa kasih indikasi apakah seorang anak perlu dukungan.
Okay, on your second page of your booklet, you will have a copy of this slide. These are the common screening tools. Of course, there are many others. These are the ones that we have chosen to speak to today. We have the MCHAT, or the Modified Checklist for Autism in Toddlers. That will be our main focus today, so you have a copy of that in your booklets. No need to look at it right now. You can look at that afterwards.
Ya, di lembar kedua ada beberapa contoh atau yang bisa kita gunakan sebagai dukungan screening. Ada yang pertama MCHAT, itu dalam lembar Anda, nggak perlu dibaca sekarang, tapi nanti akan ada diskusi lebih lanjut. Yes, Kate?
We will briefly look at the ages and stages questionnaire and the parents' evaluation of developmental status. Both of these screening tools are general developmental screening tools.
So for parents to fill or?
One isn't.
Oke. Juga ada kuesioner terkait dengan usia dan tahapan perkembangan yang juga terkait salah satunya akan diisi bersama dengan orang tua.
Then we will look at the ADEC, the AS Detect, the RAPID, the SACS, and the screening tool for autism in toddlers. So we'll look at the rest of those that you have on your page, and I will talk through how they work and some of the different considerations.
Ya, semua ini nanti akan kita pelajari hal-hal penting dan apa yang perlu kita pertimbangkan ketika menggunakannya.
The Ages and Stages questionnaire is a really useful tool. This is a parent questionnaire, so parents can complete this with guidance of a healthcare practitioner or a therapist, but they can complete it on their own.
Jadi ini adalah kuesioner usia dan tahapan perkembangan. Biasanya diisi oleh orang tua, namun bisa dipandu atau didampingi oleh skilled professional.
So this tool looks at the development from birth to 6 years old, so it's quite a wide range. And it looks at general developmental, social, and communication milestones.
Oke, ini bisa digunakan dari anak sejak lahir hingga usia 6 tahun dan utamanya untuk melihat bagaimana perkembangan anak dan kemampuan sosioemosionalnya.
So it's a really useful tool to help educate parents on developmental milestones.
Dan selain sebagai assessment, ini bisa jadi alat yang sangat berguna untuk memberi pengetahuan pada orang tua tentang perkembangan secara umum dan sosioemosional anak. Yes, Kate.
The parent's evaluation of developmental status is also a general developmental tool, and this looks at developmental, behavioral, social, emotional, and health.
Yang kedua adalah parent evaluasi orang tua terhadap status perkembangan anak. Ini juga diisi oleh orang tua. Yes, Kate?
This is also a parent questionnaire, and it includes 12 questions that go through each of those developmental areas.
Ada 12 item yang bisa diisi oleh orang tua.
The difference between this one and the ASQ is that a clinician requires training to administer this and score it.
Why so?
That's part of how it was developed.
Oke. Karena perkembangannya yang secara spesifik ya. Kalau ini bedanya dengan yang tadi, kali ini orang tua harus didampingi seorang klinisi. Ya, kalau yang tadi terapis, orang yang sudah belajar bisa, tapi kalau ini harus seorang klinisi. Sama-sama mengukur tentang perkembangan, perilaku, dan sosioemosional anak.
And this tool was a prerequisite tool to inform the development of the MChat, which we'll be talking about today.
Dan alat ini sebenarnya adalah bisa dijadikan data prasyarat untuk penggunaan MChat yang nanti akan kita bahas.
Then we have the AS Detect app. This tool was developed by La Trobe University in Melbourne, and it is a free app that people can download and access. This one is specific for autism.
And anyone can use it.
Yes.
Ini adalah aplikasi yang dikembangkan oleh Universitas La Trobe di Melbourne, namanya AS Detect app. Ya, ini free karena bisa di-download oleh banyak orang. Yes.
So it looks at children between 11 and 30 months, and it looks specifically at social communication.
Ini bisa digunakan untuk anak usia 11 sampai 30 bulan dan fokus kepada kemampuan atensi sosial dan komunikasi serta perilaku.
So it uses a series of videos that parents can watch, and they can link that to their child, and they can then record their child's behavior according to that. And it provides a report directly afterwards via email.
Oh wow. Jadi, ini komunikasi sosial, di mana orang tua nanti bisa membuat video anaknya, di-upload, dan nanti akan keluar laporan tentang bagaimana komunikasi sosialnya dari aplikasi ini. Keren ya? Keren. Keren means cool. Yeah.
The next one is the Social Attention and Communication Surveillance Tool. That's quite a mouthful. The SACS, we call it the SACS tool.
Yang berikutnya SACS atau alat untuk pengamatan atensi sosial dan komunikasi sosial anak.
Because this one's autism specific as well, it has a look at the different communication components. So it looks at whether a child is using gestures. It looks at whether a child is using gestures for social communication, so whether they might be waving or nodding. It looks at eye contact, imitation, sharing interest with others in social play, and also whether the child is using pretend play.
Jadi ini karena fokus kepada komunikasi dan atensi sosial, maka pengamatan akan sangat melihat bagaimana anak berkomunikasi menggunakan nonverbal atau gesturnya, bagaimana dia gunakan gestur untuk meminta sesuatu, kontak mata, apakah ada bermain imajinasi, ya. Ini bisa dilihat menggunakan SACS tool.
Unfortunately, this one requires training too, but it's useful to know that there is an option in it.
I see. It's non-clinician tool. It's clinician tool. Ini adalah penting didampingi oleh seorang klinisi dan harus ada trainingnya. Yes.
The ADEC, 12 to 36 months, it will look at. It's also autism specific, and this one is clinician administered too.
Ini berikutnya adalah deteksi autisme pada masa usia dini atau ADEC.
The screening tool for autism in toddlers is also a really quick screen. This one doesn't require training and is also specific.
Ya, ini ada panduan untuk screening pada kanak-kanak dan anak usia dini. Ini free dan non-clinician ya. It's non-clinician.
Non-clinician.
Ya, semua orang bisa belajar.
Yes. We've got one more before we talk about the MChat.
Okay.
So this one's called the Rapid Interactive Screening Test for Autism in Toddlers. And this is a specific tool that they call it a level 2 screening tool, which means if in the MChat, for example, there is an indication that it could be autism, the Rapid is a secondary screening tool that can be used beyond that to get a confirmation.
Okay.
So it's a slightly more detailed, in-depth
Is it
screening tool.
validity?
Yes.
Oke. Jadi ini berikutnya adalah alat untuk screening autisme pada kanak-kanak yang sifatnya rapid atau cepat, singkat. Ini digunakan setelah kita menggunakan MChat dan melihat ada indikasi autisme. Yang menarik adalah ini adalah semacam penguat validitas screening. Jadi screening pun ternyata butuh penguat validitas yang menggunakan rapid alat ini. Yes.
Okay, so let's talk about the MChat. So that was a really brief overview of a number of tools that you may be interested in. We'll focus on the MChat today, but those ones now you know of, and if you ever need to use them or access them for any reason, you can do that. There's information on each of their websites.
Jadi tadi adalah overview tentang berbagai alat screening yang bisa kita pelajari, akses, gunakan. Tapi hari ini kita akan fokus kepada MChat. Yes, Kate.
So the MChat is probably one of the most universally used screening tools now because it can be used by anybody and training. So it can be completed by a parent or a teacher or a clinician or anybody who is supporting the family.
MChat adalah alat yang paling banyak digunakan saat ini karena ini non-klinisi. Semua orang yang bekerja dengan anak atau hidup dengan anak seperti orang tua, guru, terapis, siapapun yang sudah terlatih menggunakannya bisa mengadministrasi MChat. Yes, Kate.
It's freely available and it has also been made in Bahasa.
Ya, sudah ada bahasa Indonesianya. Nanti kami akan bagikan PDF-nya.
So some of the considerations in using the MChat are listed here. It's easy to access and there are permissions to print it and use it freely.
Karena ini mudah diakses dan juga ada kebebasan buat kita ngeprint dan menggunakan. Perlu dipahami bahwa Australia sistemnya kalau kita tidak punya hak untuk menggunakan tidak digunakan. Tapi untuk MChat kita bisa menggunakan secara gratis.
And there's a request that the form isn't changed and that is completed in full. If anybody wants to do it differently, usually permission is required from the developer.
Tapi syaratnya tidak boleh dirubah dan semua item harus diisi. Kalau ada deviasi itu yang harus butuh persetujuan oleh pembuat alatnya.
So it's quick to score and it's highly sensitive, which means that the likelihood of it accurately picking up whether it's autism or not is high.
Dan ini tergolong sebagai alat screening yang cukup akurat. Dengan skornya kita bisa tahu memang ada indikasi autisme atau tidak.
The questionnaire includes 20 questions and the response is yes or no. So it's very basic.
Pertanyaannya juga sangat mudah. Jawabannya cuma ya, tidak. Sehingga juga memudahkan orang tua atau siapa yang mengisi. Yes.
At the end, once the scoring has been completed, it gives you an indication of low risk, medium risk, or high risk of autism.
Secara sederhana membagi 3 kelompok, total score resiko rendah, resiko sedang, maupun resiko tinggi.
If you have a score of low risk, it means it's very unlikely that it's autism, and it will redirect you if you have concerns about delays back to another tool or another health practitioner.
Kalau ditemukan skor totalnya rendah 0 sampai 2, berarti kemungkinan bukan autisme. Mungkin ini terkait dengan perkembangan yang terlambat atau developmental delays. Maka bisa diarahkan untuk menggunakan alat screening developmental delays lainnya atau perkembangan lainnya.
If you end up with a medium risk score, if the child is under 2, they will recommend redoing it at 2. Otherwise, they will recommend redoing it again in 12 months. However, what's important to know is if there is a medium risk, let's jump on board and start providing support.
Jikalau ditemukan skornya 7 atau medium, maka ada resiko. Kemungkinan besar kalau anaknya di bawah umur 2 tahun, dia harus diuji atau assess ulang pada umur 2 tahun atau 12 bulan setelahnya. Jadi bukan pengukuran berkala. Namun perlu dipahami, kalau ada medium risk artinya jangan tunggu diagnosis, treatment fungsional buat anak.
Simplify the scoring. The majority of the questions, if there is a no response, it will be likelihood of autism, except for 3 questions. Questions 2, 5, and 12. If there's a yes response, that will go into the scoring for likelihood of autism.
5,
2, 5, 12.
2, 5, 12. Perhatikan, nomor 2, nomor 5, dan nomor 12 itu item yang sangat penting. Kalau di situ ada iya, itu kita udah perlu pasang hati-hati, alert gitu ya. Kemungkinan anak ini punya autisme.
You have a copy of the MChat in
Sudah
your
kelihatan?
folders.
Ada di booklet Anda? Dua, 5, 12. Nanti dikirim PDF-nya bahasa Indonesianya. Ada kok, Bu.
If you can open up and turn to page 1.
Oh, that one. The other one. Yeah. Ada
So there are
ketemu?
20. Has found where we are?
Yeah.
Many to guide the parent for what to look for. However, there are some that are important that we will talk through today to add some extra examples to make sure that we can really contextualize the question.
Beberapa dari item ini orang tua, tapi akan satu persatu item di mana nanti ada beberapa item kita memang harus perhatikan apakah sungguh-sungguh jawabannya itu benar atau dikontekstualisasi dengan situasi saat ini.
Sometimes when a question is answered, we think of it literally. And because it's a yes or no response, we can sometimes forget to think about all the different contextualized information around that question.
Kadang-kala orang tua karena jawabannya ya tidak, mereka jawab aja literal antara ya tidak. Dan kita perlu memandu agar orang tua menjawabnya bukan hanya pada saat ini, tapi di berbagai konteks perilakunya anak sama atau tidak, ya, supaya jawabannya benar-benar kontekstual.
So for example, question 1. If you point at something across the room, does your child look at it?
Ya, toh nomor 1, kalau anak menunjuk, kalau Anda menunjuk, anak melihat nggak?
So this is about, it's important to consider the different types of pointing, because pointing across a room includes some distance, and a family might tick yes if a child responds to pointing to something close.
Contohnya, jangan-jangan ketika orang tua bilang iya, anak merespon ketika ditunjuk sesuatu, orang tua perlu dipahami, ini sebenarnya menunjuk across the room, melihat sesuatu yang jauh, atau bilang iya ketika anak melihat kalau ditunjuk sesuatu yang dari dekat. Nah, ini harus dikonfirmasi.
So we know that in autism, some children, we call it a triangle of attention.
Yeah.
So to be able to follow a point across the room, the child needs to acknowledge that the parent has something to share, and then they need to follow the direction of the point. And so it creates a triangle.
Ya, di dalam konsepsi mudah-mudahan dibaca materinya tentang joint attention, ada yang disebut sebagai segitiga. Jadi ketika anak merespon ketika ditunjuk, itu harus terjadi interaksi segitiga. Anak melihat orang tua dan melihat apa yang ditunjuk oleh orang tua. Harus ada berbagi perhatian bersama sehingga anak benar-benar merespon terhadap tunjukan.
Thank you. Question 2, have you ever wondered if your child might be deaf?
Pertanyaan kedua, mungkin curiga anak Anda mungkin tuli atau hearing impaired.
And this question is in relation to, for example, their name being called or a communication message being shared. It is different from having the TV loud, for example, or listening to loud music. It's about their attention to noise.
Jadi ini benar-benar bukan benar-benar hanya masalah bisa dengar atau tidak. Sebenarnya ini tentang atensi sosial. Apakah anak menyahut ketika dipanggil namanya? Kalau anak tidak menyahut, kita kan jadi kadang-kadang bertanya-tanya, ini masalah pendengaran kah? Atau memang persoalan atensi sosial? Pertanyaan ini perlu dikontekstualisasi seperti itu. Yes, Kate.
I won't go through every question.
Oke.
Many of the questions have some good examples.
Yeah.
And on the scoring pages, they talk through some additional questions. So if we open up to page
Yeah, follow up.
question 6.
Okay.
It looks like this.
Yeah.
You can see that if the parent answers a no response to that one, then there are additional questions to prompt that also require a yes or no response. And that helps you then get to a more defined response about whether the child meets that criteria or not.
Alat ini memang sungguh membantu untuk diadministrasi sehingga ada panduan penggalian pertanyaan lebih lanjut jikalau orang tua menjawab ya ataupun tidak. Masing-masing item ada ya, bisa dilihat. Jadi kalau orang tua jawab ya, no, maka kita lanjutkan dengan pertanyaan. Apa pernah dites pendengarannya? Misalkan seperti itu. Ini semua item ada panduan pertanyaan lanjutan.
So that's the copy of the MChat, and we will give you access to a copy of that in Bahasa.
Ya, kita akan nanti berikan PDF-nya yang dalam bahasa Indonesia. Tapi ini jadi panduan kita.
Does anybody have any questions?
Ada pertanyaan, a burning question. Kan kesempatan ini, kalau tanya. Kate, I have a question.
Yes.
With regard to attention, social attention.
Yes.
Sometimes when parents say, yes, sometimes my child respond when I call his or her name, but sometimes no. Should I make some kind of not manipulation, I call out his name to see whether it's consistent or not?
Yes. Yes. So the yes or no response can sometimes be difficult.
Yeah.
Sometimes, as you say, sometimes they will respond to the question and sometimes they won't. So our guidance on that is, what do they do more of the time?
Oke. Jadi ada kemungkinan ketika kita tanya, ketika dipanggil menyahut nggak anaknya? Orang tua bilang, ya kadang-kadang nyaut, kadang-kadang enggak. Perlu nggak kita coba panggil anaknya supaya kita tahu apakah jawabannya kurang lebih sama dengan gambaran saat ini. Menurut Kate itu bisa dilakukan, tapi yang paling penting adalah kita menanyakan lebih sering anak menyahut atau tidak menyahut ketika dipanggil namanya. Karena itulah gambaran yang lebih tepat untuk dicatat di MChat. Ada pertanyaan? Yes. Ibu,
Can I provide one more
okay,
response to the
yes.
question?
Sambil siap-siap.
Sorry. The other important consideration is the environment. Some environments are easier to use a skill in than others. And so we need to think about what is the most likely environment for that child. So for example, if a mother calls their child's name when they are at home and it's quiet and he's comfortable, maybe he will respond. But if he's in a busier environment, maybe where there's guests at the home or whether they might be at the shops or he might be at school where there's lots of distractions, maybe those are the environments that they won't respond.
Oke. Dan kita juga perlu mempertimbangkan lingkungan. Karena kadangkala anak bisa merespon mungkin ketika lingkungannya lagi tenang, gitu ya. Dan kita bisa cek Itu apakah ketika menyahut respon lingkungan, respon menyahut tuh ketika lingkungannya seperti apa? Itu yang jadi pertimbangan kita dalam penggalian data ketika mengisi MChat. Silakan Ibu singkat ya.
Thank you from your explanation. We admire to medium risk after the scoring 3 and 7. Or every each question no, we should start with follow and reverse question.
The way that the tool was developed is to follow the full scoring guide. So every time that you use a no, you would follow the decision-making tree. But you can use that, you can use your judgment. If it's a very obvious question, if the child never shows that skill, or if they always show that skill, it's going to be an easy answer. But if you have a discrepancy where sometimes yes, sometimes no, that might be a time where you follow the full scoring.
I think the important thing that Kate said early on that it's really important not to miss is that you don't have to have a perfectly completed MChat. All you need to actually know is that from that screening tool, you have a child with need, and then you address that need. It doesn't matter whether you get the perfect score. It doesn't matter whether you get a medium or not. It's a good exercise to go through. It's important, but the most important thing that you're looking for is a profile of a child's need, and no matter what the scoring is, if the child has a particular functional need, you address it through programming. And that was one of the points that you made earlier, Kate.
Baik, yang ingin ditekankan oleh Kate pertama adalah ketika jawaban tidak jelas atau kurang konsisten bilang ya atau tidak, tugas kita menggunakan panduan pertanyaan lanjutan untuk mengkonfirmasi ulang. Tapi yang John ingin tekankan adalah kita nggak perlu terlalu terfokus untuk nyelesain alat ukur ini untuk dapetin skor bagaimana. Yang penting kita berusaha isi, dan kalau kita lihat ada kebutuhan anak, masalah dengan fungsi dia sehari-hari, itu yang harus diadres dengan intervensi. Ada pertanyaan lain? Relax ya, relax. They look really serious, Joanne. They do. Maybe because of my face. Yeah, maybe we should dance. Ya,
Okay.
silakan.
Thank you. Saya membaca beberapa poin. Ini seperti menggambarkan bahwa ini untuk mengetahui bagaimana karakteristik interaksi sosial, komunikasi sosial, dan beberapa poin juga menggambarkan repetitive dan restrictive behavior. Tetapi kita tahu mungkin beberapa poin seperti pada di number 5, this is a little example, ya sedikit contoh tentang perilaku yang digambarkan seperti menggoyangkan shaking their finger, menggoyangkan jarinya di depan mata, tapi mungkin beberapa pattern, beberapa pola dari repetitif atau restricted behavior menggunakan pola yang berbeda. Apakah ini memang merujuk seperti itu? Terima kasih.
Thank you. There are the range of social communication questions that are in there really identify that social nature of autism, and sometimes that social nature can then lead on to some of the behaviors that we might see related to social skills that they still need to develop, as well as communication. We see behavior as a form of communication. So if there are communication skills missing, that's often when you see behavior. So you will assess for the communication and the social skills prior to that. Why there's so little about behavior-related questions in the MChat compared to social communication.
Ini mungkin terkait dengan keprihatinan orang tua ya, membawa anak pertama-tama masalahnya kan memang kok anak saya nggak bisa ngomong atau komunikasi sosial, sosioemosional. Tapi yang Kate sampaikan bahwa sebenarnya komunikasi dan perilaku sering terkait. Kalau ada masalah di komunikasi ya pasti ada dampaknya ke perilaku dan sebaliknya. Masalah perilaku akan mempengaruhi komunikasi anak. Sehingga kalau di sini ditemukan, sebenarnya kalau mau detail lagi memahami perilakunya bisa menggunakan alat yang lebih detail pada perilaku selain MChat. Yes, Joanne?
So, as I understand, the question is why are there not more behavioral questions
correct.
in the MChat,
Mhm.
right? One of the points that we make out, and again, Kate just said it now, a lot of the behavior you see in autism is a result of the difficulties that the child has in other areas.
Jadi persoalan yang dialami oleh anak sebenarnya bisa berasal dari kesulitan-kesulitan yang lain.
The difficulty the child has with communication, the difficulty with how the child reads a social situation, their inability to read social situations.
Jadi misalkan masalah perilaku, itu mungkin karena anaknya tuh nggak bisa memahami tanda-tanda sosial, komunikasi sosial di sekitarnya, sehingga memunculkan masalah perilaku.
So the reason we pick up and identify children early is because we want to identify them before those behaviors really start becoming embedded.
Inilah fungsinya assessment dini, supaya sebelum muncul masalah perilaku, kita udah bisa identifikasi apa saja hambatan atau persoalan anak.
Because we often say that behavior is the communication of last resort for a child who cannot communicate in any other way.
Karena sering yang kita lihat, perilaku itu adalah sebenarnya cara anak. Dan ketika anak udah kepepet untuk mengkomunikasikan sesuatu, karena nggak bisa ngomong atau mengkomunikasikannya, dia melakukan problem perilaku.
So it really makes sense that the MChat is actually identifying the core features of autism. And the secondary features of autism really becomes those behavioral issues that are the gap between the child's skills and their ability to respond.
Oke.
So
Jadi
the MChat is really looking at the core issues. The behavioral things are the sequelae, are often the result
dampak.
of
Yeah.
that disability and that disability not being treated.
Jadi MChat memang dibentuk untuk menangkap apa inti dari persoalan autisme, yaitu di komunikasi sosial. Dan perilaku itu dianggap sebagai sekunder atau dampak dari persoalan inti di komunikasi sosial anak ini. Itu sebabnya MChat ini cukup efektif dan teliti. Yes, Kate.
Okay. Oh,
Another question, yeah. Maju aja nggak apa-apa, Pram.
Yeah, thank you for your explanation. I think I want to highlight another part of the question that was asked. It was about a bit of the technical aspect of using MChat. So he was asking about number 5, for example. Number 5 is specifically referring to a wiggling hands or something like that. So he was asking about, does it has to be like that? Or is there any, like, what is the limit around wiggling hands? Like, is there a variations across just the wiggling hands? Or, yeah, how about other behaviors that may occur that may not be covered within the items? Yeah, thank you.
usually, yeah, that's a good question. Many kids use their hands in various ways.
Itu pertanyaan yang baik, karena anak memang suka main tangannya dengan cara banyak.
So the way that we can identify whether it's unusual, which is the word that they use in the MChat, is if it's starting to impact on their function. If they're using their hands and flickering them in front of their face, for example, that it starts impacting them being able to use their hands in a functional way to feed themselves or to dress themselves or to take note of important things in their environment because their eyes are covered. That is when it becomes more of a concern for the child.
Ya, ketika anak bermain dengan tangannya, yang perlu kita amati adalah apakah bermainnya itu fungsional dan apakah itu menghambat dia untuk melakukan tugasnya sehari-hari, hidupnya sehari-hari menggunakan tangan. Misalkan jadi menghambat dia makan atau melakukan aktivitas lain. Inilah yang perlu kita lihat dari aspek item ini.
I think what they're also trying to pick up is there are some very stereotypical hand movements and finger movements that children with autism make, right? Right?
Mhm.
Some very, and so it's a really, you very rarely see it outside of autism. It's very stereotypically autism. And don't forget, this is a screening tool that's just trying to say that it's more likely than not
Yes.
the child has autism. So does the child, and there are reasons, this is self-stimulatory behavior where a child is actually trying to screen out too much information
yeah.
from the environment. It's a form of little self-hypnosis, just to make everything go away. I screen out with my fingers. So really what they're looking at, they're really just trying to pick up on that. It's such a stereotypical, it's not somebody waving about. It's a very, very stereotypical thing that a child does with their eyes to screen out the environment. And so again, it's just more likely than not. Is it a perfect thing? No, but is it more likely than not? And that's really what they're trying to pick up there.
Ya, ini adalah alat screening. Memang tugasnya untuk cepat menangkap apa resiko atau kemungkinan indikasi anak punya autisme. Tidak harus detail karena memang ini bukan tugasnya sebuah alat screening. Dan memang pengulangan, perilaku berulang itu secara khas punya anak autistik katanya Joan. Jarang di anak kebutuhan khusus lainnya. Karena bermain tangan di depan mata ini adalah upaya untuk mengontrol stimulus cahaya yang masuk ke matanya. Atau mungkin semacam hipnosis diri supaya dia lebih tenang. Ini adalah cara dia mengendalikan stimulus masuk ke dalam dirinya atau dipersepsikan oleh matanya. Jadi itu cuma khas pada autistic. Yes.
So in summary,
Yeah.
there are some 5 main considerations, just in summary of the different tools that we've discussed. So there's a range. You can choose either whether a developmental screen as a starting point might be more suitable for the family, or whether you know that you want to go straight to an autism specific tool like the MChat. There's the training component required, and that is a big barrier. So really, it's more likely that we'll be using the tools that we can access that don't require training.
Ya. Berikut adalah 5 hal penting yang perlu kita pertimbangkan sebelum memilih atau ketika kita akan menggunakan alat screening. Pertama, apa yang ada yang bisa diakses. Tadi kita udah bahas ada beberapa jenisnya ya. Yang kedua, kita tuh pengen benar-benar fokus untuk melihat gejala spesifik autisme, mungkin lebih cocok alat yang sifatnya lebih diagnostik atau clinician assisted. Tapi kalau pengen lihat secara umum, kita cari alat-alat yang juga lebih umum. Terus apakah alat ini perlu training apa enggak? Kita punya enggak kapasitasnya? Usia anak yang diamati kapan? Dan juga cost. Karena juga orang tua perlu kita pertimbangkan. Cukup mampu enggak dia untuk mendapatkan assessment tertentu?
The age group is another consideration. Some of the autism-specific tools is a smaller age group that's valid for a smaller age group. So you might then need to extend that to a broader age group as well. So that will guide you in your selection of tools too.
Terkait dengan usia, tadi saya kecepatan. Usia ini akan sangat penting kita pakai alat apa karena ini tergantung age group atau kelompok usia yang diukur pada alatnya. Yes.
And the cost. Yes.
Yeah, for parents.
Of the tool itself. So there's various costs. There's the cost of the tool itself for some of those resources, and there's the cost of the training that might be required.
Cost juga selain apa yang harus dibebankan, tapi juga cost untuk kita, untuk training. Ada beberapa alat memang sangat mahal. Nah, ini jadi pertimbangan kita.
So the AS Detect, the app, is free, and the MChat is free. The AS Detect app.
AS Detect app ya itu gratis yang tadi dari Latrobe and MChat. Itu 2 hal yang bisa disarankan untuk digunakan karena gratis dan accessible.
To add one point onto the age group, if MChat is if you've got access to the MChat and the child is slightly older than the MChat age range, which is 3, it is still relevant because you can, even though the research says it's until 3, there will still be some of those features that the family can reflect on from the child, and still some of those features that might still be present.
Okay. Jikalau anak udah lebih dari usia yang misalkan MChat 3, tapi bisa tetap kita gunakan untuk paling enggak untuk mengajak orang tua refleksi tentang apa saja yang dialami atau dimunculkan oleh anaknya.
One of the questions we get asked quite often is my child shy or is it autism?
Ya, ada pertanyaan yang sering muncul oleh orang tua. Anak saya ini pemalu atau autistik ya?
So we've identified some of the common behavior or mannerisms or characteristics that you might see that are different. In general, if a child is shy, you might only see them being shy in certain situations. So, for example, at home, when they are with their family who they're comfortable with, or when they're with their close friends, you might see them communicating, you might see them playing, and you might see them interacting as their peers.
Ya, kita perlu melihat pola perilaku anak di berbagai setting. Karena misalkan untuk pemalu ya, biasanya mereka di situasi yang familiar bersama keluarga, mereka lebih mau berinteraksi sosial, komunikasi.
And if they're shy and they move into a different environment where they are less comfortable in, so something that's unfamiliar or where there are unfamiliar people, that's where you might see those skills are not used. So they might become more quiet, they might become more reserved in their play, and they might not interact in the same way as they do in their home environment.
Tapi kalau di anak pemalu, di tempat baru atau yang tidak biasa, dia akan lebih nggak berinteraksi, menarik diri, atau mungkin tidak bermain, tidak menggunakan keterampilan sosial yang biasanya muncul di tempat yang familiar.
So shyness is more situational.
Jadi pemalu itu situasional.
Whereas if it is autism, it's skill or lack thereof. So it's different. So you would see the same presentation or a similar presentation across environments.
Sedangkan autisme, keterampilannya yang tidak ada atau terbatas, sehingga kemampuan bermain, melakukan kontak sosial sama kurangnya di berbagai setting.
So you might see a child who is minimally verbal at home, and you would see them minimally verbal at school.
Jadi kalau anak gak banyak bicara di rumah, sama di sekolah juga tidak banyak bicara.
So that's the main difference between shy and autism.
Itu, konsistensi adalah kunci perbedaan pemalu dan autistik.
The other common question that we get is determining what the difference is between whether a child is having a tantrum or whether they're having a meltdown.
Ya. Ada pertanyaan berikutnya, ini anak sedang tantrum atau meltdown? Saya terjemahkan sebagai kewalahan sensoris.
So the behaviors that you see might look the same. Maybe kicking, spitting, shouting, running, hitting. They might look the same. But how do we know whether it's a tantrum? And how do we know whether it's a meltdown?
Perilakunya bisa aja sama, marah, nendang, gigit, lempar. Tapi udah gimana kita tahu bedanya?
Because the way that we support the child will be different.
Karena cara kita memperlakukan, merespon anak akan berbeda.
So a tantrum is usually goal-directed. It usually occurs when a child wants something that they can't have.
So tantrum itu ada tujuannya, goal-directed. Dia pengen mencapai sesuatu dengan marahnya.
And usually the tantrum will stop when they get given what they want.
Dan kalau tantrum bisa selesai pasti karena keinginannya tercapai.
Whereas what's different with a meltdown is the child has become so overwhelmed by a situation that they go into shutdown mode. And even if they wanted something and you now give it to them, the meltdown doesn't stop because they're so overwhelmed that their brain is trying to cope with what's going on.
Bedanya dengan meltdown atau kewalahan, itu anak udah kecapean karena terlalu banyak hal dari lingkungannya yang membuat dia udah terpaksa nutup diri. Dan inilah yang menjadi perbedaan. Karena walaupun kita mencoba menenangkan anak, tidak akan ada yang berguna. Karena anak begitu sudah kelelahan, kewalahan, sehingga dia cuma bisa melakukan meltdown.
So even though the starting point might be the same and it might be related to having something that they're unable to have, the environmental implications or the environmental considerations and input for that child, the sensory, the noise, the history of the day, all of those features might have built up, and this might just be the icing on the cake for the child.
Oke, mungkin saja baik meltdown maupun tantrum sama-sama ada yang pengen dicapai ya. Tapi bedanya kalau kita menghadapi meltdown, kita harus mempertimbangkan kondisi lingkungan untuk menenangkan anak. Karena perubahan itulah yang membantu anak turun dari status kewalahannya ini Misalkan sensoris, apakah terlalu bising, terlalu terang, itu kalau diturunkan maka meltdown-nya juga akan turun. Oke.
Any question?
Question, pertanyaan. Jadi bedanya kalau tantrum, kalau anak udah dapat keinginannya selesai. Tapi kalau meltdown, walaupun udah dikasih apa yang anak butuhkan, misalkan nggak mengerjakan tugas, dia bakal tetap meltdown ini. Apa yang harus kita lakukan? Lingkungannya lah harus dikondisikan. Karena biasanya anak autistik punya profil sensoris yang harus kita kendalikan lingkungannya supaya mereda kewalahannya, kecapeannya. Question, ada pertanyaan? Maybe not now. Yeah, continue.
There is a link to all of the websites in your booklet that will guide you to some very useful information about autism characteristics and also the various screening tools. So please have a look at that. It's on the next
Yeah.
page, page 3, for further information on any of the topics that we've discussed this morning.
Ada beberapa sumber bacaan lanjutan yang bisa Anda akses. Silakan mengaksesnya, ada di buklet Anda. Yes, Kate.
I'll just talk a little bit more about screening. Our next section after our morning tea break is going to be about functional assessment. So we will go into the details of that after the break. But I'll just make a start to flow from what we've talked about in relation to screening and how that's different from functional assessment.
Okay.
So we know that screening provides us with an overview or a guide. And it gives us a strong indication that we should start working on providing supports to that child in the way that they need that. So the functional assessment is then what we would look at. It's really looking at how does that child's day-to-day life look? What are their strengths within that day-to-day life? And what are the areas that are real challenges for them that we can provide support with? And it's looking at the different domains of autism. So you're looking at communication, you're looking at behavior and sensory, you're looking at self-care, but it's really about getting a good understanding of what does the daily activities that that child is doing and the impact of some of those challenges on those areas, because those will be the keys to determine how we then look at providing supports. So the functional...
Okay. Maybe I can translate. Jadi Ibu dan Bapak, tadi pagi ini kita udah dikasih overview tentang berbagai screening tool. Berikutnya setelah break nanti kita akan belajar tentang screening fungsional. Apa itu? Kalau screening itu memberikan gambaran umum tentang gejala autisme dan kira-kira indikasinya kuat atau tidak sehingga bisa dilanjutkan dengan asesmen lanjutan. Tapi kalau asesmen fungsional, kita mengamati perilaku anak sehari-hari. Bagaimana fungsi hidupnya sehari-hari di berbagai domain, termasuk komunikasi, belajar, atau berbagai domain lainnya nanti akan dibahas setelah break bersama Kate. Yeah.
Just to make the difference, the screening tool tells me tells me that there's something not going on, not developing as it should. The functional assessment tool basically that Kate is going to look at is as Kate says, is going to, I know there's something that the profile of the child isn't as it should be. Now it's going to drill down into what areas are not working for that child, right? And that's the thing. One screen tells me there's something going on that's not normal, right? That's not as it should be. Now this is going to tell me what are the areas I need to work in. And that's the functional screening tool.
Jadi ini bisa dilakukan berkelanjutan karena screening tool kasih kita red alert. Ini kayaknya ada indikasinya. Nah berikutnya harus diikuti dengan bagian apa, fungsi apa sehari-hari anak yang bermasalah atau kita sebut atipikal yang tidak sama seperti anak usianya. Inilah fungsi dari screening fungsional.
So the screening tool is generally a one-off screen. You sit down and you complete the screen and that guides you to your next steps. The functional assessment is about gathering information over time, because even though you'll get your information and your baseline skills at the beginning, you really want to be gathering information about, is this goal right for the child? Are the strategies working for them? Are we seeing changes? What do we need to adapt? So it's really about always looking at at how the supports are working for that child, and are you making a difference for them?
Oke, jadi kalau screening biasanya itu cuma sekali karena tujuannya untuk mendapatkan indikasi. Sedangkan fungsional akan berkali-kali sepanjang kebutuhan perkembangan dan pendidikan anak karena kita menangkap kebutuhannya, apakah terapi atau treatment kita berdampak pada anak, sehingga ini adalah dokumen organis.
And a functional assessment involves all the environments that the child is playing in or working in or learning in.
Dan kita akan mengumpulkan profil anak di berbagai lingkungan yang anak hadapi dalam hidupnya. Oke.
Oh, we like to...
Yeah, let's do it.
All right, that is the beginning of the end of our first session.
Yeah.
We will have a break for morning tea now.
Mhm.
If you could come back in 15 minutes, please.
Yes.
Have a snack and get some movement.
Yeah.
A little walk.
A little walk,
Yeah.
maybe a dance.
A dance.
Jadi teman-teman kita akan break 15 menit, mohon kembali tepat waktu supaya kita bisa memulai. Ya, silakan ada kopi teh, rekan-rekan yang bagian di depan kopi teh, rekan-rekan koordinator makanan silakan membantu. Absensi apakah sudah
Writing jobs.
full words? Cool.
Four.
Four words. More and help. Oke. Contohnya paling gampang, kalaupun kita mau bantu, dua kata yang paling inti dipelajari adalah lagi dan tolong. Karena kata-kata ini sangat versatile, bisa kita pakai di berbagai konteks dan sangat fungsional untuk membantu anak hidup sehari-hari.
So the reason we might start with core words over something specific, if we teach them the word help, they can use it at home. They can use it to help with getting dressed. They can use it to help when they need something to eat. They can use it to help when they need to go to the toilet, and the same at school. If we taught them the word, something that's important for the child, like teddy, for example, that only can be used when they want their teddy.
Ya, kenapa ini menjadi kata inti atau core words? Karena dengan minta tolong, itu bisa anak gunakan kata tolong untuk minta tolong dibawa ke toilet, minta tolong makan, atau melakukan sesuatu di rumah atau di sekolah. Jadi bisa digunakan di berbagai konteks lingkungan. Beda kalau misalkan cuman kasih ajar tentang boneka, namanya Teddy gitu. Atau bapak misalkan, bapak mungkin masih. Ya itu nanti cuman bisa digunakan untuk satu spesifik boneka itu saja. Tidak bisa digunakan di berbagai konteks.
And the last point is around being collaborative. So we've already spoken about you include the family, but you also include anybody else who is important in that child's life. If you are a clinician or you're working in a hospital, we need to include their teachers. If you're working in a school and you are their teacher, we need to include maybe if they've got any health practitioners who are helping.
Health practitioner. Jadi ini juga proses fungsional assessment adalah kolaboratif. Tidak pernah dilakukan oleh satu orang. Selain bekerja sama dengan orang tua, mungkin ada orang-orang yang bekerja dengan anak seperti guru maupun tenaga profesional kesehatan lainnya yang bisa membantu memberikan informasi fungsional.
I just wanted to acknowledge the planning matrix. I know many of you are very familiar with this document, and many of you might be using this already. And this is a great tool to understand. It looks a bit different to the ones you're using, but it's the same concept where you look at the different domains of autism, you identify the characteristics, and you have a look at the impact and the strategies. We won't be talking to that today, but some of the information might be similar.
Yeah. Actually, they have read the reading materials on planning matrix. Tolong dibaca ya. Jadi ini adalah planning matrix sebagai salah satu alat assessment fungsional yang dibuat oleh Positive Partnership. Ini yang digunakan mungkin tampak berbeda karena ini disesuaikan dengan kebutuhan, namun ini adalah planning matrix.
There are three key areas or tools that we use in assessment. The first one is the assessment domains. So those are the different characteristics of autism that we assess.
Ada beberapa komponen dari assessment fungsional. Yang pertama adalah domain atau area yang akan diukur.
We also need to consider the environmental observations across home and school.
Lalu yang kedua kita juga akan memahami observasi pada lingkungan.
And of course, the parent and teacher interviews for the information.
Komponen berikutnya adalah interview dengan orang tua dan guru.
You have a copy of this slide in your notebook.
Mhm.
So-
Ada di dalam handout Anda? Ya, ada. Yes, they have it.
Yes, that's the one.
Ya.
So we'll start talking through each of the domains of the assessment.
Dan kita akan mengurai satu persatu dari domainnya.
And please make notes as you need to, because we'll be using the information to practice an assessment after this.
Tolong Anda mulai mencatat pemahaman Anda, nanti akan kita gunakan dalam latihan.
The key domains that we're assessing for in a functional assessment for autism are communication, behavior and sensory, social and play, self-care, motor skills, and their thinking and learning styles.
Berikut adalah beberapa area yang akan diukur. Pertama, komunikasi. 2, perilaku dan sensori. 3, bermain dan sosial. Self-care, keterampilan motorik, dan berpikir dan belajar.
And the reason we look at all of these domains and not just the social communication, which is typically part of the screen and the diagnosis, is because each of these different areas can be impacted, and we're looking at the child as a whole. So we want to make sure that we're providing the right supports across all of their different strengths and challenges.
Mengapa domain ini yang dipilih? Karena karakteristik autisme bisa berdampak kepada domain-domain ini, area ini. Dan inilah nanti yang akan kita identifikasi apa dukungan yang perlu diberikan terhadap domain-domain ini.
Let's start with communication.
Kita mulai komunikasi.
We look at communication in terms of 2 different components. We look at expressive language, which is the way that we express our thoughts and feelings and wants.
Komunikasi ada 2 komponen. Pertama, kemampuan ekspresif. Bagaimana menyampaikan ide atau apa yang ingin disampaikan kepada orang lain.
And we'll also look at receptive communication, which is the way that we understand information provided to us.
Dan kedua adalah komunikasi reseptif, bagaimana kita memahami informasi yang kita terima.
When we're expressing ourselves, there are a number of different ways and skills that we learn when we're first starting to communicate. And many of these are nonverbal communication. So these are ways that we look at each other. There might be noises that we make to express a thought or a response. They might be different ways that we use our hands to show gestures. They might be different ways that we use our body or our heads. So we're wanting to look for some of those non-verbal communication functions as well, because that shows us that there's an intent to share a message.
Jadi dalam mengkomunikasikan diri kita, mengekspresikan diri kita, lebih banyak komunikasinya nonverbal. Cara kita menggunakan suara kita, cara kita menunjuk, atau menggunakan berbagai gestur. Tapi ini adalah komunikasi juga karena ada niatan untuk melakukan komunikasi dari diri kita ke orang lain. Okay.
With an intent to share a message, we can build on skills. It's the starting point of supporting communication.
Kalau ada niat, maka mengajari komunikasi ekspresif menjadi lebih mungkin.
Once a child has all their early precursor communication skills, we call them, they're the early skills before functional communication can start.
Jadi di dalam tahapan perkembangan bahasa ada yang disebut tahapan keterampilan komunikasi dasar atau prekursor. Ini adalah yang harus dihadapi oleh seorang anak sebelum menjadi lebih mampu mengekspresikan dirinya.
Then we have a look at the different functions of communication.
Lalu kita akan melihat fungsi dari berbagai cara berkomunikasi.
So there are a number of different functions that we would use communication for. We use communication to make requests. When we want something, we'll be able to share that message. And they can be done non-verbally or verbally.
Ya, di dalam kemampuan dasar, keterampilan komunikasi dasar atau precursor, ada gerakan misalkan, artinya pengen ambil itu. Nah, ini adalah kemampuan anak mengekspresikan diri dengan cara yang paling mendasar.
So some children might use exactly that. Some children might use a point or a gesture, or they might walk to an area of the house or the kitchen where the item is that they want. So often we'll find children will walk to a kitchen cupboard if they're hungry and there's something in the kitchen cupboard that they want to eat.
Ya, cara mereka mengekspresikan komunikasi dasar ini bisa macam-macam. Bisa seperti tadi menggunakan ganti baterai. Oh oke, lupa deh tuh. Ya, macam-macam. Bisa dengan menunjuk. I completely forgot because I was distracted.
So I gave an
Yeah.
example
Yeah.
about if a child uses different ways to communicate what they're
Yes,
requesting.
correct.
So they might use their body,
Mm.
they might use their hand
Yes.
to point in the
A voice.
direction of something,
Mhm.
or they might make a vocalization.
Yeah. Jadi bisa bentuknya vokalisasi, tunjuk. Bisa juga anak datang ke dapur untuk ngambil makanan karena dia mau makan. Ini adalah yang sesuatu yang kita harus peka bahwa ini adalah komunikasi dasar dari anak autistik.
So those are all very important early signs of communication.
Itu adalah contoh-contoh kemampuan dasar berkomunikasi. Memang belum verbal ngomong, tapi bahwa tunjuk, tarik tangan mau ambil makanan, itu adalah komunikasi ekspresif dasar.
The other communication functions that we'll be assessing for are whether they can comment on things that they're doing. So they might be playing with a toy that they like, and they might make a comment, "Yay!" or "Train." So that's commenting on what they are doing.
Ya, mungkin juga bentuk ekspresifnya adalah memberikan komentar ketika lagi main. Ada luapan kesenangan, "Yay!" Ha, ya, itu adalah ekspresi juga.
And sometimes that might just be commenting to themselves because they're enjoying it themselves, but sometimes they might also be sharing that comment with a play partner.
Dan kadang-kala perhatikan apakah komentar itu hanya untuk dirinya sendiri atau dia melakukan kontak dengan orang lain, berbagi ekspresinya tersebut.
So we also want to have a look at the use of language. So for a child who is verbal, how are they using their words?
Ya, kalau kita sekarang bicara tentang kemampuan berbahasa, kita akan mengecek juga bagaimana kata-kata atau bahasa yang digunakan ketika anak berkomunikasi.
So are they talking to themselves? Are they guiding their words to a communication partner? Are they coming up with their own words? Or are they using pre-scripted words that they've learned?
Ketika mereka berkata-kata, ya, kita bisa lihat itu kata-kata yang memang ada di dalam bahasa atau bikin sendiri. Bahasa yang sesungguhnya atau bahasa bikin sendiri. Dia bicara pada dirinya sendiri atau juga sudah berbagi, berbicara dengan orang lain. Ini yang harus kita amati.
It's very common for some children with autism to use echolalia. Echolalia is when a child repeats words or a phrase that they've heard elsewhere.
Di dalam komunikasi sering orang autistik melakukan ekolalia, mengulang persis apa yang dia dengar. Ini adalah bentuk ekspresi, tapi tentu saja tidak fungsional karena hanya mengulang persis apa yang dia dengar.
So often they might repeat a phrase that their family uses. In the video, you'll see that there is an example of that. Or they might also, if they do have any screen time and they watch movies, sometimes they can repeat phrases from their favorite movies when they are playing.
Nanti ada video di mana kita lihat seorang anak meniru persis apa yang disampaikan atau dikatakan di keluarganya. Atau mungkin ada anak-anak yang melihat TV atau game, kata-kata tertentu dan diulang-ulang. Ini adalah ekolalia.
And then one of the more complex skills in communication is the use of narrative.
Dan berikutnya kita juga akan melihat bagaimana penggunaan kata-kata atau bahasa yang lebih kompleks. Seperti membuat cerita atau narasi.
Because to be able to use narrative in your language, you need to have each of those prerequisites before.
Ini menjadi kompleks karena untuk bisa membuat cerita, kita harus punya dasar-dasar keterampilan komunikasi sebelumnya dari nonverbal, precursor, dan yang lainnya.
A narrative is about our ability to retell a story.
Narasi artinya kemampuan seseorang menceritakan ulang sebuah cerita.
So I'm sure you can understand when a family picks up their child from school, they're always very interested to know what they've done in the day.
Misalkan ketika anak pulang sekolah, orang tua bisa bertanya, bagaimana, apa yang kamu lakukan sehari-hari di sekolah? Nah ini adalah meresponnya dibutuhkan kemampuan narasi.
Can I ask a question,
Yeah.
Kate? So Kate, you've been going through a lot of these areas that you're going to assess, and you've been giving examples of what you're going to assess. How is that going to help you? And I know you're probably dealing in the next, but how is that going to help you? That's a lot of information you're gathering. What are you going to do with that information?
Ya, ada pertanyaan dari Joanne. Ini banyak ya domain dan detail dalam hal komunikasi. Lalu dapat informasi ini apa? Bagaimana saya sebagai asesor, orang yang menggunakan assessment fungsional, bisa menggunakan informasinya?
So what we're wanting to do with this information is you're observing, you're collecting, and you're documenting this. You're writing it down in a format that works for you.
Jadi yang penting juga setelah kita mengamati, kita perlu mencatatnya dengan format yang paling pas buat kita untuk merekam.
Because once you've got all the information across each of the domains, you then have a look at how you're going to prioritize that information into a functional goal.
Karena nanti setelah terkumpul rekaman tentang profil anak, kita akan melihat secara umum jadi mana prioritas yang harus ditarget.
We will go through each of the domains and then we will have a look at how we prioritize and select goals. I have a tool for you that we will share.
Oh, nanti Kate akan memberikan tools bagaimana kita tahu dari berbagai domain yang profil anak yang kita udah kumpulkan, kita tahu mana duluan yang harus diprioritaskan untuk dia terapi. Ya.
So when we talk about receptive language or our understanding of language, we need to assess some of those different areas as well. So
Sama seperti ekspresif, reseptif juga punya beberapa komponen.
So starting with following instructions. So there are many, many instructions that we all have to follow every day.
Pertama, bagaimana anak mengikuti instruksi.
Can they follow a simple instruction? We call one-step instruction. So there's one thing that they need to follow in that instruction. For example, put your shoes on.
Ya. Di dalam memahami instruksi ada beberapa tahapan. Tahapan paling pertama adalah satu instruksi. Jadi ini yang paling sederhana. Di dalam satu kalimat hanya ada satu tugas yang harus dia lakukan. Contohnya pakai sepatu. Itu satu instruksi.
Or can they follow an instruction that has two components to it? So put your shoes on and get your school bag.
Bisa juga anak sudah meningkat kemampuan memahami instruksinya menjadi dua tugas. Misalkan pakai sepatu lalu ambil tas sekolah. Itu dua. Dan seterusnya, beberapa kompleks.
We also have a look at whether they can respond to questions and the types of questions that we can ask develop in complexity. So for example, if you're asking them, what would you like to eat? That might be quite a straightforward question. But if you're asking them, why did you choose that? That question is a lot more abstract. And so sometimes those questions can take a little bit longer to develop.
Dan terkait dengan merespon pertanyaan, ada beberapa jenis pertanyaan. Yang biasanya lebih mudah adalah kalau pertanyaan yang sifatnya konkret dan jawabannya cukup jelas. Contohnya, kamu mau makan apa? Bisa langsung dijawab, bakso gitu ya. Tapi pertanyaan ada yang kompleks karena sifatnya abstrak. Biasanya bentuknya pertanyaan opini. Menurut kamu sukanya makanan apa? Nah itu bingung kan, tidak mudah buat mereka. Mereka kan butuh waktu lebih lama atau sesuatu bantuan untuk menjawabnya.
So questions with a concrete answer are much easier for people with autism than questions with an abstract answer.
Ya, pertanyaan yang jawabannya konkret akan lebih mudah dijawab oleh orang autistik dibanding yang sifatnya abstrak.
And then lastly, we discussed about the communication functions expressively. So requesting, commenting, using narrative. We want to work out if they understand those functions also.
Ya, sebaliknya ketika terkait dengan tadi kan ekspresif memberikan komentar, merespon. Nah, bagaimana dia bisa memahami komentar orang lain, respon orang lain, ini adalah bagian dari komunikasi reseptif yang akan kita amati.
Okay, then we'll move on to social and play.
Kita masuk ke domain berikutnya, bermain dan sosial.
So when you're assessing social interaction, you want to have a look at the ways that the child interacts.
Di dalam komponen interaksi sosial kita pengen lihat bagaimana anak merespon berinteraksi dengan dunianya.
Are they including somebody else in their play? or are they playing on their own?
Apakah mereka bermain sendirian atau sudah bermain bersama dengan orang lain?
Do they know how to approach a friend at school to ask them to play? Or maybe they might be pushing them because they want to play but they don't know how.
Apakah anak sudah bisa mengundang orang lain untuk bermain bersama dia, atau dia masih maksa temannya bermain sama dia tapi nggak tahu cara mengemukakannya?
We want to have a look at whether they're able to share and take turns. So sharing can sometimes be difficult because the amount of time that a child is playing with something that they want is a bit more abstract.
Jadi kita juga pengen lihat bagaimana anak berbagi dan bergantian. Misalkan terkait dengan alat bermain. Perlu dipahami, kadangkala waktu adalah konsep yang terlalu abstrak untuk dipahami anak. Ini akan berpengaruh pada kemampuan interaksi sosialnya.
And we want to have a look at whether they can take turns. That might be in a very obvious game where they are running one truck through the sand and then the other child runs their truck and then, they take turns running a truck each.
Yeah. A bit of context here I can explain about in education Australia perhaps. Jadi pendidikan dasar di Australia itu memang mengajarkan anak untuk bisa mampu berinteraksi sosial. Makanya bergantian, berbagi itu penting. Bahkan anak berkebutuhan khusus pun diajarin itu. Nah inilah hal yang sangat penting dilakukan. Karena dengan juga mendukung pemahaman anak tentang waktu, anak jadi tahu kapan bergantian. Karena bergantian kesannya mainannya diambil terus gak bakal dibalikin. Anak perlu paham juga tentang konsep menunggu. Ini juga menjadi dukungan untuk melakukan interaksi sosial. Yes, Kate.
And wanting to have a look at friendships.
Yeah. Kita juga pengen anak kita punya teman.
So do they have people who they enjoy interacting with? And do their friends enjoy interacting with them?
Ya, kita juga pengen anak senang berteman dengan orang lain. Dan orang lain juga senang sama dia.
Does anybody have any questions
Ada pertanyaan
about assessing for social interaction?
terkait dengan cara mengakses interaksi sosial? Dan komunikasi. Komunikasi dan
Communication.
sosial dan bermain. Monggo. Sifatnya langsung ini ya, lanjut. Oke, monggo Mas. Majuan aja Mas biar cepat kita Mas. Mas Ujo. Iya. Saya paham ini emang levelnya langsung jebret gitu ya. Ada teori bermain, teori paling mendasar kita kausal.
Baik, terima kasih pertanyaannya.
Ya, silakan.
Yang saya pahami, okay, thank you for a very interesting information that you gave.
My pleasure.
I'd like to ask about the communication. I'm sure that not only the topic, what kind of question that we ask for them, but the ability of they answer the questions reciprocally. Both sides. Is that something to need? That they have to do that?
Yes. So you're asking if we would assess for whether there's the reciprocal questioning
Yes.
between each other and the conversation?
Yeah.
Yes. Great question. Thank you. Absolutely. And that would include their communication skills and in the ability to express their needs or ask a question. It would include their receptive skills, whether they're able to understand the question or the comment. And it includes a social element as well, because they need to have the skills to be able to attend to a communication partner. Absolutely. So that's a very good area to assess for. You want to add?
Yeah, and I think, there are going to be a range of skills because all of the children that you're going to assess is going to be different. So for one child, you might simply be, when you've done that profile, when you've done the assessment, you might actually, your intervention with that child might be getting them to respond to one other person, maybe the mother, the caregiver. But for another child who's got more developed communication, you might be looking at how you expand the range of people they interact with or the range of circumstances that they interact with. And that gets back to what Kate was saying about being individualized. For one child, it will be a much smaller goal. For a child with more skills, you'll be expanding their goals. And so that's the point of assessment. It's not academic. It's how I'm going to take that information wherever the child is and expand from where the child is.
Jadi yang ingin tadi ditanyakan mungkin bagaimana memahami kemampuan reseptif anak dan kita merespon dia paling pasnya seperti apa. Yang John pengen tekankan, ini nanti bukan cuma sekedar catatan, tapi akan berdampak pada kerja kita bersama anak. Misalkan, kalau kita tahu anaknya kemampuan reseptifnya masih instruksi satu kata, jangan membuat instruksi yang dua kata atau kompleks. Kalau kita tahu kemampuan anaknya masih mendasar, di mana pemahaman terhadap hal abstrak sulit, jangan tanyakan opini, tapi tanyakan dalam bentuk pertanyaan konkret sehingga lebih mudah dijawab. Kira-kira berdampak nggak Anda sebagai guru, sebagai dokter? Ya, ketika melakukan assessment, kita akan menggunakan kemampuan reseptif anak dan mulai dari komunikasi dari situ. Kalau kita nanti jadi terapis, tentu saja mengembangkan program terapi dari kemampuan anak dan berlanjut menjadi lebih meningkat. Kira-kira bisa dipahami? Okay. Another question?
Could I just add,
Oh, yeah, okay.
add to that? Because I really want to emphasize the importance of why we're doing this.
Yeah.
The issue, the importance isn't to get a nicely completed form that tells me where the child's strengths are and the child's difficulties are, and then put it in a file, and that's a really nice completed academic exercise. That's not the purpose.
Yeah. Joanne ingin menekankan, ini bukan cuman suatu hal pengetahuan ya, akademik. Ngisi form, selesai, dokumennya indah.
If I'm just going to put it in a file, I might as well not do it at all.
Kalau cuman jadi file, nggak usah dikerjain, ngerepotin orang.
The only purpose of this is to focus on how I am going to assist the child to develop their skills. So this is just the initial paperwork that helps me to look at where we're going to start with the child.
Jadi pemahaman dari assessment ini akan menjadi dokumen kita untuk bagaimana mendukung anak berikutnya. Jadi ini bukan tentang harus detail-detailan, rinci-rincian, bagus-bagusan mencatat, tapi informasi ini harus dipakai betul untuk kita mendampingi fungsi anak. Silakan Ibu.
Ya, terima kasih untuk Bu Joan dan asisten ya. Perkenalkan saya Ibu Woro, saya seorang kepala sekolah di SMP Negeri 5 Surabaya. Saya mempunyai 49 anak berkebutuhan khusus ya. Ada autis, SLEN, terus DIP ya, tunagrahita, kemudian tunarungu ya. Ada sekitar 3 anak autis di sekolah kami. Pertanyaan saya agak banyak sedikit, Bu.
Dibikin sederhana. Okay.
Apakah tools ini bisa digunakan untuk anak-anak kami di SMP? Karena memang meskipun usianya SMP, tetapi usia kronologisnya SMP, tetapi sesungguhnya dia masih seperti anak balita. Satu. Yang kedua, terkait dengan functional assessment. Bagaimana sekolah dapat mengintegrasikan hasil asesmen fungsional yang mencakup kekuatan dan tantangan siswa dalam perencanaan program belajar yang sesuai dengan kebutuhan. Yang ketiga,
Bu, nanti saya lupa loh Bu.
Oh iya,
aja ya.
2 aja dulu deh, nanti tambahannya. Terima kasih. Satu aja, tambah satu ya, karena untuk peran keluarga. Bagaimana peran keluarga dapat lebih dioptimalkan dalam mendukung proses pembelajaran anak di sekolah berdasarkan hasil asesmen fungsional.
Baik,
Itu saja.
terima kasih. So she has 3 questions. A principal from middle school in Surabaya. She has 4 students with disability. No, inclusive school, a public middle school. So she has 3 children, autistic students. And she has question 1. Can she use as a teacher, even though her students are in the teenage period, MChat? Can MChat be used for that kind of student with that kind of age group? Secondly, how she can use this functional assessment in order to develop the learning support for the students, for them to learn in the school. And thirdly, how can we ask parents or family to contribute in this process? Yeah.
Thank you. So if you already know that the children have autism, or you already identify that they've got autistic features, let's start doing a functional assessment to support their program at the school. And yes, you can use this format for all of them. And yes, you would very much involve their parents in that process. So depending on their skill set, you might be assessing for a slightly different nature of the skill within each of those domains, but the domains are still relevant, and you would still gather the information and combine it and work through the programming, which will be a section that we get to after lunch.
I'd also add one other thing. Functional assessment in this format is very, very useful, very, very good. But if you're in a school, for example, and you find that the young person with autism is getting very stressed and very overwhelmed at assembly time, I don't need to sit down and do a functional assessment to actually know I need to do something about that, right?
Baik, yang dijawab oleh Kate adalah satu, kalau anak sudah adolescent atau remaja, langsung saja ke functional assessment, nggak perlu MCAT. Dan di functional assessment akan melihat beberapa domain yang di sini nanti jadi panduan, tapi Ibu bisa modifikasi domain lain yang dibutuhkan di sekolah yang harus diobservasi. Dan ini harus melibatkan orang tua mengisinya. Namun yang Joanne ingin sampaikan, ada waktu di mana siswa terlalu stres. Jadi nggak bisa kita amati diem, tapi ada triknya. Yes, John.
Yeah. Tools have a place, but they're one of many things. So in the case I raised of the child getting overwhelmed, I would look at the strategies I'm going to put in place to support that child, or to let them do an alternative activity at the time of assembly. I don't need to sit down and do a functional assessment to actually know that that child functionally is having great difficulty with assembly. I can observe that, I can see it, I know I need to do something about it.
So you don't have to wait until you complete your data, just do something.
No, you absolutely don't. Really, it's functional. If I know the child has an immediate difficulty, they're getting stressed, do something about it and use the autism profile to develop your strategies. And I think you'll be talking a bit more about that today. If I'm doing a comprehensive assessment, this is really good. This gives you a really good profile of how I develop a comprehensive assessment. But I'm going to put however. Could you just translate that bit?
Jadi Ibu, domain-domain ini yang dijelasin secara detail nanti akan dilanjutkan dengan strateginya. Tapi nanti siang ya. Nah ini jadi panduan kita untuk membantu anak. Yang disebut functional assessment, kita nggak boleh diem kalau ngelihat anak kesusahan. Hanya karena kita pengen data. Jadi kalau ngelihat anak kesusahan, ya lakukan sesuatu sesuai dengan strategi yang akan kita pelajari berikutnya.
And in relation to the parents, I think really, really important. But when you're dealing with parents, you have to deal with parents as members of the team. They're equal members of the team. That's really important. It's not you bringing the parent in to tell the parent what to do. It's you and the parent working together to know what is the best strategy for that child.
Ini salah satu kunci prinsip dari pendekatan kita. Kita harus melibatkan orang tua. Bukan kita yang ahlinya ngatur apa yang dilakukan oleh orang tua. Tapi kita bersama orang tua untuk membentuk apa instruksi, pendekatan, intervensi yang terbaik buat anak.
Yeah. So thank you.
Okay. Interesting isn't it? Ini ya, semakin terbakar. Ada pertanyaan lain? Ya, ada pertanyaan one more. Yeah. Itu, Bu Aminatun, Bu Daima tunjukin tangannya dong. Nah. Oke, monggo.
Terima kasih atas kesempatannya Bu Reta. Ini yang menjadi pertanyaan saya kaitannya dengan mengajarkan anak yang untuk bahasa reseptif misalkan. Tadi sudah dijelaskan juga sama Juan atas terjemahan dari Bu Reta, jadi saya lebih paham gitu bahwa kita tidak bisa tidak boleh mengajarkan, andaikan anak itu hanya bisa menggunakan satu kata, kita tidak boleh untuk mengajarkan dua kata. Yang menjadi pertanyaan saya adalah bolehkah kita mengajarkan artinya dua kata, tetapi
dua tugas.
Tapi itu sifatnya adalah rutinitas gitu, tidak menjadi target utama. Karena selama kalau kita amati rutinitas yang selalu dilakukan anak, terus kemudian itu meskipun dia masih tahapannya dia masih hanya bisa memahami satu kata, tetapi kalau misalkan dilakukan terus-menerus, misalkan gitu, anak akan lebih paham karena itu sifatnya rutin gitu. Terima kasih.
This is Daima, special teacher. she asked with regard to receptive communication. So it was mentioned that if the child understands 2 tasks in a sentence, will we give the instruction in 2 tasks? But if only 1 task, give the 1 task, at least that's a start. Is it possible, even we know the child is only able to understand 1 task sentence instruction, but we give them 2 tasks in 1 sentence in order to push them into understanding a routine?
Yes.
Yeah, a schedule.
Yes. So for now, we're talking about the assessment part. So you're working out where they are. If they understand 1 step, that's their current level of skill. And then when you set their goals, absolutely, you want to extend them. And we always set a goal 1 step above where their current skill is so that they're always growing and learning.
Pertanyaan yang baik, ini terkait dengan perencanaan treatment, intervensi. Kita memang akan mengajak anak untuk bertambah kemampuannya, tapi ini memang harus sesuatu yang direncanakan dan anak siap untuk prosesnya.
And when you're setting a goal of moving from 1 step to 2 step, you want to have all the different supports in place to help them understand that. So you might have some visual supports in place to help them understand the 2 steps involved. You might build it into a routine that they used to do and maybe used to having help with, but you're wanting them to become more independent. You might adjust the amount of support that you're providing, so the prompting. I will talk more about this in the next step. For now, we're just having a look at how do we assess to work out where is their current baseline skill level.
Ya, strategi akan lebih detail nanti dijelaskan, tapi betul bahwa nanti sebelum kita mengajak anak lebih naik, lebih tingkatnya naik lebih tinggi, pastikan dukungan sudah ada, misalkan visual, prompting itu tersedia atau struktur lingkungan yang lebih tertata sehingga anak lebih mungkin sukses untuk naik ke 2 tugas.
Does that answer your question? Okay, thank you.
Okay.
Okay, so as part of the social and play assessment, we want to have a look at their understanding and use of emotions. We can divide emotions based on our basic emotions, which might be happy, sad, angry. And if a child understands that, we can have a look at the slightly more complex emotions, like maybe surprised, content, excited. So we look at separating emotions in 2 categories.
Terkait dengan emosi, kita akan melihat apakah anak mampu mengenali emosi dasar seperti sedih, senang, ya. Berikutnya, kalau memang anak sudah lebih lanjut, dia juga lebih mampu mengenali emosi yang lebih kompleks seperti terkejut, jijik, ya.
And we want to have a look at whether theory of mind is starting to develop. Theory of mind is our ability to understand that somebody else has different thoughts and feelings to our own.
Ya, di dalam materi Anda ada tentang theory of mind, yaitu kemampuan untuk memahami dan memahami pikiran atau perasaan orang lain.
And that is a key learning or cognitive function within people with autism. Developing theory of mind is a challenge.
Di anak autisme, theory of mind ini perkembangannya agak terhambat. Padahal theory of mind, kemampuan memahami pikiran orang lain, menjadi kunci untuk mengenali emosi.
So for many children with autism, they think that the things that they like to do and the things they like to see are the same as everybody else.
Jadi karena kesulitan memahami orang lain, dia berpikir sentralistik ke dirinya. Kalau saya suka sesuatu, orang lain juga pasti suka. Dia sulit memahami perbedaan pikiran dan perasaan orang lain.
So if a child has a special interest in dinosaurs, maybe, they want to keep talking about dinosaurs all the time, and they think we want to keep hearing about dinosaurs all the time.
Misalkan anak punya minat tentang dinosaurus, dia pikir semua orang suka tentang dinosaurus, maka dia terus berbicara tentang dinosaurus.
Which is not always the case.
Ya, padahal nggak semua orang suka dinosaurus.
Any questions about emotions?
Ada di Theory of Mind, baca Baron Cohen sama Uta Fried, itu referensi dasar. Ya, kalau ada pertanyaan, monggo. No, maybe not, but no.
Okay, we'll have a look at how we assess for play. We know that play is the most important occupation for every child. So it's really important that we have a look at where their skills currently are, and so that can define how we then extend them.
Terkait dengan bermain, kesannya untuk anak-anak ya, tapi orang selalu punya bermain. Nah di sini kita akan belajar tentang memahami apa pola anak bermain, tipe bermainnya, apa yang dia mainkan. Yes.
So we can have a look at play in two different ways. We look at the types of play and the stages of play.
Kita paling tidak harus melihat dua komponen bermain, tipe bermainnya dan tahapan bermainnya.
Types of play involve their choice of toy. So are they playing with sensory toys? Do they like playing in the sand? Do they like playing with things, the sensory toys like that you've got on your table? So do they like things that feel nice or that feel spiky? Do they like playing with their hair, for example, if they've got hair? That's the sensory stage of play.
Stage, ya.
Or type.
Type. Ya. Oke, jadi pertama tentang tipe bermain. Tipe bermain pertama ini adalah bermain sensoris, di mana mainan dinikmati berdasarkan apa sensori atau stimulus yang muncul. Misalkan ini warnanya, sensoris sentuhnya. Nah ini adalah tipe bermain sensoris. Ini adalah salah satu tipe bermain. Ya.
So sensory is our first type of play that we all begin to engage with the world in. Once we move from sensory play, we might play what we call cause and effect. So that's where you play with a toy and you do something to it, play with a toy or something in the environment and you do something to it and something happens.
Right, no.
So
Okay.
yes, for example, with
Yang-
this, if you push one of the buttons, it goes in and makes a noise.
Oke, jadi yang tipe kedua bermain biasanya yang sensoris itu yang katanya yang paling dasar. Berikutnya bermain sebab akibat. Kalau sebab akibat kita menikmati permainan karena ketika dilakukan sesuatu ada dampaknya. Kalau ini dipencet ketekan, kalau ini dipencet gitu. Nah itu adalah bermain sebab akibat.
Or if they kick a ball, the ball rolls. So it's about that they can actually influence the toy or the game that they're playing with.
Jadi anak menikmati ketika mereka melakukan sesuatu pada alat permainan terjadi dampak. Dilempar bola, bolanya bergulir. Ini adalah sebab akibat. Dilempar barang jatuh.
And then after a child has developed sensory play skills, cause and effect play skills, they'll be starting to engage in pretend play skills. That's when they're pretending to be in the role of somebody. So often they might use dolls or they might dress up and pretend to be a doctor or a dentist or a pilot.
Yang tipe permainan ketiga imajiner. Di sini sudah ada role play. Seakan-akan saya adalah perawat, dokter, guru.
And pretend play and role play require the use of their imagination.
Nah, bermain imajiner itu membutuhkan kemampuan ya betul. Role play atau bermain pura-pura membutuhkan kemampuan imajiner.
And using the imagination can be a challenge for many children with autism.
Dan karena hambatan theory of mind-nya, ini yang menjadi hambatan buat anak-anak autistik untuk melakukan bermain imajiner.
So when you're having a look at how they might pretend play or role play, often you will teach them one step, maybe feed the baby, and then you wait, and then you might teach them two steps. Maybe you feed the baby and you put a blanket on it to bed, and often the child will rote learn those steps and repeat them, but it might be difficult for them to add on their own steps using their imagination.
Ya, terkait dengan bermain pura-pura, anak-anak autistik sulit melakukannya sendiri. Maka butuh di scaffold, didukung perlahan-lahan kemampuannya. Pertama-tama mungkin main anak-anakan gitu ya. Diajari dulu cara ngasih makan anak atau ngasih minum anak. Lalu diajarin berikutnya cara mengayun-ngayunnya gitu. Jadi ini perlu dilatih. Tidak bisa secara alamiah begitu saja mereka bisa berpura-pura atau bermain pura-pura.
A question for Kate. So would you, normally when you're looking at a child with autism, would you expect to see pretend play?
Pretend play is something that might develop later on. And often for the children that we are supporting, we need to teach them the steps of pretend play. It doesn't always come naturally.
So if you're teaching the steps of pretend play, is it really pretend play?
We pretend to pretend. Yeah.
You're basically you're teaching them ways of
To adjust.
developing a skill set so they
Yeah.
can interact with other children, but it's not true pretend play.
You're right. You're right. That's something we could.
You're teaching them pretend routines.
Yes.
Right? Would you say that's true, Kate?
Absolutely, yes. So with pretend play, there is the act of doing it, which can often be learned, and then there's the ability to have the ideas in your mind and the imagination for each of those steps. For our children, we often teach them the act of doing it so that they can engage with their peers.
Jadi ini yang menarik. Anak-anak kita berdasarkan riset sebagian besar memang punya hambatan theory of mind. Jadi pada titik tertentu bisa dibilang mereka akan sulit berimajinasi. Jadi ketika kita mengajari mereka bermain pura-pura, pada dasarnya yang kita ajari adalah perilaku bermainnya. Bagaimana cara merespon lingkungan pada situasi bermain, ini loh cara bermain peran. Tapi kita tidak akan merubah, langsung mengintervensi kemampuan imajinasinya. Karena ini yang memang sesuatu yang terhambat. Jadi istilahnya Joanne, kita mengajari anak untuk berpura-pura. Tapi jangan berharap bahwa dia langsung bisa berpura-pura. Kita hanya mengajarkan dia perilaku untuk masuk di dalam lingkungan sosialnya.
So one of the early, I think, signals that a child has autism, especially in toddlers, is you'll ask the parents, how does he play, right? And the parents will say, oh, he plays really great. He builds Lego, he builds Lego blocks, or he has cars that he lines up, or he's got things that he likes to assemble. He plays really well. And what you can actually tell is he's not playing imaginatively, right? You say that?
Absolutely.
So basically you see, could you maybe just translate that?
Jadi misalkan kita mengobservasi anak dengan bertanya juga pada orang tuanya. Jadi anak bermainnya seperti apa, Bu? Ibunya jawab, oh dia mainnya bagus, dia numpuk puzzle, dia nulis-nulis, dia mengurutkan. Tapi dengan pemahaman tipe bermain, kita tahu semua permainannya tidak ada bermain pura-pura, tidak ada imajinasi di sana.
So, imaginative play, very simply, you can see the child who picks up a banana and says, hello, are you there? As a phone. Very simple imaginative play. That banana is a phone. And you don't usually see that with autistic children, but you can see it with normally developing children. So there's that lack of imaginative play at a very basic level, or a very basic thing of, I'm going to pretend to be somebody and you're somebody else and we will do this. And that's really the thing you don't see in people with autism. And it's a it's a signal that stands really out in early developing children.
Ya, bedanya dengan anak tipikal, perkembangannya tipikal, mereka biasanya natural karena ada theory of mind. Umur 3-4 tahun mereka bisa main pura-pura, misalkan ngambil pisang terus jadi phone. Halo, apa kabar? Ya, ini biasanya tidak terjadi pada anak autistik karena hambatan di theory of mind-nya sehingga mempengaruhi bermainnya. I have a question actually. Some of us here working with adolescent, how does play relevant with autistic adolescent teens? Play relevant, or how we can gather information about play and interaction with adolescent. How can we use that?
With adolescents.
Yeah.
Yes, absolutely. So play looks different as people get older. Play is generally what we call it in early childhood or with children. And we refer to it for students mostly through their learning styles and the way that they interact with their peers. So some of that play might be called more social skills and the way they interact with activities that their peers might be interacting in. It might look different. It might be more out and about playing basketball, or it might be playing different running games outside. That's the way that their time and their enjoyment is occupied. And then as they get up into adulthood, there will be different occupations, so different hobbies that they pick up, or they might try and do some work. So it's the hobby that occupies their time.
Oke. Jadi menurut Kate, bermain itu sepanjang umur sebenarnya ada. Pada usia kanak-kanak sering kita sebut sebagai bermain karena kesannya tujuannya hanya untuk pleasing gitu ya. Tapi pada masa remaja sebenarnya bermain ini ditransformasi menjadi keterampilan sosial. Gimana bisa get along sama teman-temannya, ngobrol kah, atau melakukan bermain drama atau pura-pura. Dan pada masuk adulthood, biasanya ini berbentuk seperti hobi. Apa yang senang dilakukan, kalau dilakukan memberikan kesenangan. Ini sebenarnya adalah komponen bermain.
And that's a very good question because it's very important for your functional assessment and your intervention to be age appropriate.
Dan memang penting dalam functional assessment supaya yang kita amati sesuai dengan kategori kategori umurnya. So with regard to adolescent, we need to see how they use their social skill in making friendship. Ya, jadi kalau remaja bermainnya itu selain yang tadi kita lihat bagaimana dia bermain bersama teman, menghabiskan waktu bersama teman, apakah dibully misalkan. Ya.
So we'll move on to behaviors and interests. And this is something that is really important to use in your assessment because it will guide how we can implement the strategies and the intervention in their program. So many children with autism have difficulty with transitions. So that's moving from one task to another, or it's moving from one room to another, or it might be leaving home to go to school. There's lots of different transitions in our lives, and those can be really difficult for some of our children.
Oke. Salah satu karakteristik autisme adalah minat terbatas dan perilaku berulang. Nah, ini yang tergambar di dalam domain sensori dan perilaku. Hambatan pada gejala hambatan ini biasanya berdampak nomor satu pada transisi. Kemampuan anak berpindah dari satu tugas ke tugas yang lain. Karena keterpakuannya, kesukaannya pada suatu hal, objek ataupun aktivitas, dia jadi susah bergerak dari satu bermain atau belajar ke belajar yang lain atau bermain yang lain.
So when you're looking at transitions, they might have a different skill profile within that. They might be okay with moving from one activity to another when it's part of a routine that they've practiced many times. But it might be difficult to move from an activity that they really enjoy to an activity maybe that they don't enjoy.
Dan perlu dipahami, profil kesulitan transisi itu bisa khas pada suatu anak. Ada anak yang pada kegiatan tertentu dia nggak masalah pindah dari satu kelas ke kelas yang lain. Tapi biasanya mereka akan sulit pindah dari satu kegiatan ke kegiatan lain kalau kegiatan itu dia sangat sukai. Jadi dia pengen bertahan di situ.
So you want to understand what are the transitions in a child's life in their assessment, and you get that information really from their family.
Jadi kita perlu bikin profilnya. Apa sih bagaimana anak ini melakukan transisi atau hambatan transisinya? Kita harus ngomong sama keluarganya untuk dapat datanya.
You also want to have a look at how do they follow adult direction. And there's a difference between following an adult direction and understanding the adult instruction.
Ya, berikutnya tentang mengikuti perintah dari orang dewasa di sekitar. Perlu dipahami ada perbedaan antara pemahaman perintah dan melakukan perintah.
So they might have the communication skills to understand the instruction that's been provided to them, but they might choose not to follow the instruction.
Ada anak sebenarnya paham instruksi yang diberikan oleh orang dewasa, tapi memilih untuk tidak melakukannya.
So when you're assessing, you really want you need to understand, is it their communication skills or is it a behavior?
Dan ini artinya kita sebelum memahami perilaku, kita harus paham betul karakteristik komunikasinya. Anak tidak melakukan karena tidak paham, karena komunikasinya terbatas, atau ini adalah perilakunya, bahwa dia memilih untuk tidak melakukan apa yang diperintahkan.
You also want to have a look at, are they able to stop a task before it's finished? So they might be doing some coloring in and it's time to finish in the classroom and go outside for a break. Are they able to stop before they finish their coloring in picture?
Dan kita juga perlu mengamati apakah anak bisa diperintahkan untuk berhenti walaupun waktunya sebenarnya belum selesai. Ini terkait dengan keterpakuan mereka terhadap rutin yang harus berulang-ulang. Mereka biasanya kesulitan.
Or for an older child, they might have been given a task to complete, maybe some maths work, and the siren or the bell or the indication goes that it's time to move on to their next class. How do they cope with not finishing the task?
So can they just making voices, you mean?
So we're assessing how do they manage? Are they okay to close their book, put it in their bag, and move to the next class, or do they struggle with that transition because they haven't finished the activity as they had expected?
Coba cek anak ketika diperintahkan untuk berhenti walaupun waktunya belum selesai. Apakah dia adaptif, dia menutup bukunya, lalu bergerak ke aktivitas berikutnya, atau dia jadi cranky, rewel karena merasa waktu belum selesai.
You also want to have a look at their attention span. So for many children, their ability to pay attention might be impacted by their sensory needs. So for some children to be able to attend, they might need to move more, or they might need to have their fidgets, or they might need to have their tasks made shorter because they can't attend for as long maybe as their peers. So you want to have a look at what is their current attention span.
Ya, kita juga perlu memahami durasi atensi mereka bagaimana, berapa lama. Apakah perlu break atau apakah perlu alat stimulus sensoris untuk meningkatkan, misalkan alat remas-remas atau bergerak di dalam ruangan pada titik tertentu dia harus bergerak supaya tetap alert. Nah, ini menjadi bahan perhatian kita.
You want to have a look at, do they cope with change and do they cope with making a mistake?
Oke. Dan berikutnya kita juga pengen lihat bagaimana anak mengelola kalau mereka menghadapi perubahan, jadwal mungkin atau melakukan kesalahan.
So maybe if they've arrived at school and they expected their subjects to be in a certain order, but those have had to change maybe because one of the teachers is sick, how do they cope with that?
Keterpakuan mereka pada jadwal biasanya menyulitkan mereka kalau ada pergantian. Misalkan dari jadwal harusnya guru A, B, C, ternyata guru B nggak ada hingga langsung harus guru C. Nah, bagaimana dia menghadapi perubahan seperti ini?
Does anybody have any questions about
Ada
behavior
pertanyaan?
and interests?
Ya, Nilna, maju aja Nil, biar cepet Nil.
It's about thank you. It's about my student in my school. How does puberty affect a child behavior? And then, if there are negative change in behavior, what are the best steps to address them? And then it's necessary to repeat the teaching that were previously given, and consider that after entering puberty, a child behavior tends to become problematic.
Okay.
Bagaimana dampak pubertas terhadap problem perilaku anak?
Yes.
Ya, apa yang harus kita lakukan? Intinya gitu ya. Oke, thank you Nilna.
So the question is assessing for puberty or assessing for changes in behavior around puberty?
I think it's more about how puberty impact behavior. Okay.
Yeah. Great. We'll talk to some of those changes a little bit more detail tomorrow. But for today, puberty is a big part of an adolescent's life, and it does need to be considered in the assessment and in the processing. So some of the strategies that we'll go through later on will still be relevant. So it's about adapting them to the specific needs of the person who's going through puberty and what is being impacted for them.
Yeah, you're right. Jadi Ibu, Bapak, bagaimana dampak pubertas? Pubertas adalah hal yang alamiah. Saya pernah lihat ada anak yang ketika masuk pubertas menunjukkan ketertarikan, jadi suka pegang rambut anak perempuan misalkan. Nah, ini bagaimana? Besok akan diulas lebih detail, tapi ini adalah bagian yang memang harus diperhatikan dalam mengamati perilaku.
So during puberty, they might be feeling more overwhelmed about their feelings. They might have different pains that they haven't had before. So it's about using the same strategies and adapting them to their specific changes that they're experiencing.
Misalkan juga anak bisa ada pain, misalnya menstrual pain atau perubahan tubuh. Nah, ini functional assessment melihat itu lalu membuat suatu rancangan yang memang bisa membantu mereka untuk menjadi lebih optimal menghadapi pubertas atau perubahan tubuhnya.
Does everybody need a bit of a movement break? It's pretty warm. Yeah.
Kelihatannya kita agak sedikit.
Let's do a quick walk.
Okay.
We'll just walk down here, walk back up there. We'll do a snake and then back to your desks.
Ini salah satu contoh memahami kebutuhan sensoris peserta. Mari kita bergerak, berdiri. Kita akan
walk down here, up here, down there.
Bikin angka 8. Yuk, kita muter kayak angka 8. Ikut yuk. Ikut yuk. Ayo ikut. Ini jadi jalan terus, jalan. Ayo, yuk. Disuruh bergerak, ini disuruh bergerak. Ini contoh sensory break. Sesuai dengan kebutuhan peserta. Ya. Baik, terima kasih. Kalau sudah 1 kali, boleh dilanjutkan sampai 7 kali. Enggak.
I've got one out of the others.
Langsung nggak perlu karena kan MT kan
Iya, dia bilang udah. Langsung salah satu.
Iya, karena sebenarnya diagnosa itu gitu loh. Ada yang bilang aku punya 3 anak autis. Perlu kan yang ini? Nggak perlu, orang sudah tahu itu autism kan nggak perlu di sini. MCT kan nggak umur. Iya, jelas. Tapi udah autism. Iya.
Panitia jangan lupa dokumentasi. Siapa yang tugas dokumentasi? Ono, Sidoarjo. Mit. Dokumentasi. Iya. Ya wes, teman-teman tolong melakukan dokumentasi, share di grup. Karena panitia overwhelmed. Ya. Yang HP-nya bagus, tolong ambil foto. Ya. Oh ya, tadi ada pertanyaan nggak? Ada yang mau disampaikan?
Is everybody awake? You've moved?
Sudah tidur.
Can we get started?
Yeah.
Yeah.
Mohon segera kembali ya. That's okay. I think they just pick up some
So we've
food.
talked about communication, we've talked about social, we've talked about play, we've talked about behavior and interests. We have 3 more.
Tadi udah beberapa ya, komunikasi, bermain, sosial, perilaku. Masih ada 3 lagi nih.
And just remember, as we're going through this information, this is our information gathering. We're gathering information, we're completing observations because this will determine how we program and how we intervene to support the child.
Ya, jadi tadi memang sangat detail karena ini jadi panduan. Anda tidak diminta untuk menghafal ya, tapi saya biasanya menggunakan ini panduan untuk melakukan pengamatan, bertanya kepada orang tua. Karena tujuan kita dapat data sebagus mungkin supaya bisa membuat program yang terbaik buat anak.
All right, so we're going to talk about sensory processing. And sensory processing or sensory preferences it's about our way of interpreting the information coming from the world. So most of us know about our sense of taste, our sense of smell, our sight, our hearing, and our touch.
Berikutnya adalah pemrosesan sensoris. Kemampuan sensoris sebenarnya adalah bagaimana manusia bisa mencerap informasi indrawi dari lingkungannya. Dari yang dia dengar, dari yang dia rasa, dia baui.
And we also have internal senses that help guide our body in space so that we know where we are. It drives whether we need to move more or not. And it also drives when we're hungry or when we need to go to the toilet or when we need a drink.
Selain alat indrawi yang ada di luar biasanya, sebenarnya kita juga punya pemrosesan indrawi dalam. Itu yang memberikan informasi pada tubuh kapan kita lapar, kapan kita bergerak cepat atau melambat, atau kapan kita mau kencing. Ini disebut sebagai indera dalam.
So some people need less sensory information to feel it. So they can get overwhelmed very quickly in an environment that is busy or noisy or lots of movement or lots of visuals on the walls.
Mohon dipahami ini sangat penting terkait dengan karakteristik autisme. Ada beberapa anak autistik yang butuh cukup stimulus sedikit saja untuk dia bisa tahu apa yang terjadi di dunia. Suara tidak usah keras, bau tidak usah terlalu kuat. Karena kalau kebanyakan itu jadi kewalahan.
And some people are under-responsive, so they need a lot more of that. And they're the ones who might seek a lot of movement, who are bouncing a lot, who might do the flickies in their face because they want to see their fingers more and they need that visual stimulation.
Beberapa anak atau orang justru butuh banyak stimulus untuk bisa dirasakan di indrawinya. Jadi dia bakal bergerak lebih sering atau dia menggerakkan tangannya, mencari sensasi. Karena sedikit rasa kurang, dia akan mencari tambahan stimulus.
And sensory processing, if they have difficulties with some of their really strong sensory preferences, it can impact how they engage in activities every day.
Dan kalau ada anak yang minat sensorisnya sangat kaku ya, jadi nggak bisa fleksibel dengan cahaya, terlalu terang dia nggak suka, dia nggak bakal datang ke ruangan terlalu terang. Ini yang akan bermasalah terhadap proses hidupnya, hadir ke satu tempat atau melakukan suatu aktivitas.
So you want to understand what their sensory preferences are, so you can embed the strategies to help meet their sensory needs so that they can build skills on top of that.
Dan tugas kita memahami profil sensoris individual, karena masing-masing orang punya profil sensoris masing-masing dan kita akan meramu suatu proses yang lebih optimal untuk membantu mereka belajar dengan sesuai kebutuhan sensoris mereka.
So for example, you were all sitting here for a long time. So we all had a bit of a movement break and we walked around and it fed our movement system so that we can now concentrate more.
Ini tadi contohnya, kita kan duduk udah lama, makanya kita coba bergerak supaya meningkatkan kembali alertness, kewaspadaan kita untuk belajar lagi.
So for people who need lots of movement, they need to do that more often.
Buat orang-orang yang perlu bergerak, jadi stimulus geraknya lebih tinggi, mungkin mereka boleh jalan-jalan lebih sering dibanding yang lain. Ada yang berani? Ya. Yeah. The two last points over there, flexible with new ideas and packs away. Can you explain more about that, please? Yeah.
Yes. So sometimes if a child is introduced to something new for the first time, it might be too overwhelming to engage in because they don't understand all of the steps involved. So for a child who doesn't have autism, they might be a lot more able to engage in something new for the first time. But for somebody who has autism, something new might be too overwhelming and they might not be able to have that flexible thinking that it's relatable to something that they know.
Jadi pada orang autistik biasanya mereka sulit langsung fleksibel terhadap hal baru ya. Untuk orang-orang tipikal mungkin mempelajari hal baru itu menarik ya. Tapi buat mereka kadang-kadang mereka kurang paham ini belajar hal baru ini untuk apa ya, gunanya untuk apa ya. Jadi mungkin mereka jadi kayak nggak fleksibel untuk belajar hal yang baru. Nah tugas kita mungkin yang untuk mengarahkan ke sana.
And it might also relate to being flexible to thinking of new ideas around their imagination. So in class they might be asked to do an activity and the teacher might give an example of what they need to do and the child or the student with autism might not be able to create their own ideas related to that.
Misalkan guru di kelas mengajarkan sesuatu tentang coba kamu membuat sesuatu gitu ya. Nah anak jadi kurang paham kenapa harus membuat sesuatu yang baru itu. Kira-kira seperti itu. Packs away.
Packs away is about coping with the end of an activity. Yeah, so we call it packing away for young children to tidy up after they finish playing. That can be very difficult for somebody because it's finishing a task. But for an older student, it might be packing away their school books into their school bag at the end. So it's coming to an end of a task that they've enjoyed doing. At home, it might be about packing away the items in their room.
It's included in the task to be independent.
Yes.
Knowing the end.
And if they have those difficulties, Kate, which are very common, you'd be talking in your program that you're going to do about how you're going to put strategies in to assist them to be more flexible in what they do and to basically be able to cope with the end of a task. Yeah.
Jadi pack away artinya tentang penyelesaian tugas. Ya, anak-anak dengan autisme biasanya agak kesulitan mengetahui waktu dan kapan mengakhiri satu kegiatan. Mungkin bisa jadi marah atau apa. Kalau dia sudah bisa, dia akan pack away, ya rapikan tasnya, pulang. Karena itu adalah rutinnya. Dan ini, ya sorry.
So again, I just really want to I want to say it's not about identifying for the sake of it. We identify so that we're going to put in a strategy.
Yeah.
Okay?
Yeah.
Which is what the next section is about.
Oke. Jadi mengetahui kemampuan anak menyelesaikan tugas bukan cuma karena kita pengen dapat profilnya, tapi ini nanti harus dimasukkan di dalam strategi. Misalkan dia struggle menyelesaikan tugas, maka ini masuk di dalam terapi atau pendidikan yang akan kita masukkan di dalam rencana intervensi.
Okay, we're going to have a look at assessing for their motor skills. And these are important because they contribute to being able to play, being able to socialize outside, doing activities, being able to contribute to their work in class. So we'll start with gross motor.
Baik, berikutnya adalah keterampilan motorik. Ini nanti juga akan berdampak kepada kemampuan anak untuk melakukan aktivitas sehari-hari. Pertama, motorik kasar.
So we look at, with gross motor, we look at their core strength or their postural stability. Are they able to hold their body up in space comfortably and confidently so that they can use their arms and their legs?
Pertama adalah kestabilan postur tengah. Ini bagaimana dia tetap bisa stabil tubuhnya dan dengan otot yang stabil di tengah, dia lebih bisa menggerakkan otot perifer atau tangan, menggerakkan tubuhnya. Yes.
It's like a tree. Your posture stability is like the trunk of a tree, and without the trunk of the tree, the leaves won't be able to grow.
Jadi seperti pohon, tubuh itu kayak batangnya, sehingga ranting-rantingnya bisa bergerak atau terdampak lebih kuat, ya.
And we also want to have a look at their coordination. So how are they coordinating the top of their body with the bottom of their body, and also each of the sides of the body? Can they use their hands together or separately for different tasks?
Dan berikutnya kita akan melihat koordinasi, bagaimana anak bisa mengkoordinasikan gerak bagian tubuh atas, bagian tubuh bawah, bagian tubuh kanan maupun kiri, hingga bisa bergerak secara terkoordinasi.
Because all of that impacts on their ability to move, to play, to interact.
Karena kemampuan koordinasi akan berpengaruh pada kemampuan bergerak, bermain. Ya.
We also want to have a look at fine motor. So that's with our hands. So we're having a look at how are they able to, if they're using pens or pencils, are they able to hold those and control them and write with them? If they are needing to use typing, do they have the coordination in their fingers to type a message that they're wanting to share?
Berikutnya adalah motorik halus, yaitu keterampilan mengkoordinasi gerak tangan dan jemari. Jadi bagaimana menggunakan tangan dan jemari untuk mengambil, memungut, atau memanipulasi objek, ya, yang bakal banyak berguna untuk menulis atau berbagai aktivitas di dalam belajar.
And then we want to have a look at the visual motor. So it's your eye-hand coordination. So are they able to write letters in the way that they are being taught because they can see it and they can form that movement with their hand?
Oh, this is new with the motor skill. Yeah. Yang ketiga adalah kemampuan koordinasi visual dan motor. Bagaimana mengkoordinasi penglihatan dengan gerak tangan. Karena ini banyak digunakan misalkan untuk meniru, menulis.
So we know that the profile of a person with autism has a particular thinking and learning style. So we want to have a look to understand what is it that they use, what skills is it that they use to help them learn? How do they plan? How do they pay attention? How do they organize?
Kita berikutnya ingin mengetahui bagaimana anak belajar, bagaimana mereka merencanakan belajar, bagaimana mereka memusatkan perhatian.
And many of these areas can be difficult. Are they able to manage their time? And if so, what strategies are they using to do that? Maybe that's something that we need to provide them support with.
Beberapa anak pada anak autistik ini akan kesulitan karena Ada hal misalkan mereka kesulitan untuk memulai belajar atau merencanakan waktu, manajemen waktu untuk pengerjaan tugasnya sehingga mereka butuh dukungan.
And what is their memory like? Many people with autism have a really, really good memory. How do they remember things? Do they remember things in small chunks? Do they remember things in big chunks? And then we need to use that to inform how we're teaching them.
Berikutnya kita juga perlu memahami ingatan, apakah mereka mengingat dengan bertahap gitu ya, kayak ingatan satuan-satuan yang lebih kecil atau dia bisa dikombinasi antara beberapa ingatan ya. Kelompok ingatan, kelompok informasi maksud saya. Chunks adalah kelompok informasi yang diingat.
Any questions on thinking and learning?
Can I elaborate a bit about the executive function here?
Yes.
Ya, oke. Jadi ibu dan bapak, salah satu karakteristik autisme yang ada di dalam bahan materi kita yang kita pelajari, ada fungsi eksekutif ya. Ini sebagian besar yang ada di dalam komponen ini adalah fungsi eksekutif. Memulai tugas, merencanakan tugas, mengingat apa yang lagi dikerjain, menghentikan tugas, kontrol, manajemen. Nah ini yang biasanya sulit pada anak. Itu sebabnya harus ada dukungan memulai tugas ya. Nah ini tugas kita memahami fungsi anak mampunya di mana, apakah semuanya tipikal ataukah ada sesuatu yang butuh dukungan lebih lanjut. Disinilah peran functional assessment. Apakah bisa dipahami? Detailnya tolong dibaca di materi bacaan ya.
And the last one we want to have a look at, very important, is their self-care. So I've focused mostly on toileting, getting dressed, and meal times because that is a very important area for everybody.
Ya, berikutnya adalah domain perawatan diri, tentang bagaimana anak merawat dirinya sehari-hari termasuk ke toilet.
But to extend that going through puberty and growing up, it's also around, are they able to take care of their cleanliness? Are they able to shave? Are they able to look after themselves in other ways as they get older?
Kalau anak masuk usia pubertas, mungkin ada aspek perawatan diri lain, misalkan apakah bisa mencukur janggot gitu ya, merawat kebersihan area privat.
And one of the most common ways of assessing for some of the self-care skills, because many of them have routine steps in place of how you perform a task. So, for example, when you're getting dressed, you are likely to always do that in a similar order. So we call it forward or backward chaining.
Untuk melakukan perawatan diri, sebenarnya itu adalah rutin. Buat kita semua juga gitu. Kayak pakai baju dimulai dari mana dulu, misalkan atas dulu atau bawah dulu. Ini bisa dibuat menjadi rutin.
And what that means is breaking the task up into all of the little steps that are involved. So when you're getting dressed, you put your socks on, you put your underwear on, you put your pants on.
Ya, jadi artinya tugas merawat diri bisa dipecah-pecah menjadi satuan perilaku yang lebih kecil, lebih mudah dikerjakan. Bisa forward, misalkan sesuatu yang dari atas dulu, atau backward dari bawah naik dulu. Nah ini yang perlu kita amati bagaimana anak mampu melakukannya sehari-hari.
So can they do all of those steps or some of them?
Mereka bisa mengerjakan sebagian perawatan diri atau semuanya, sudah cukup mandiri perawatan dirinya.
Okay, so that sums up all of the domains.
Oke, itulah domain yang harus kita amati ketika melakukan functional assessment.
Okay, so what we're going to do now is we're going to watch a video.
Okay.
This is a teacher showing you an example of how she's using one very simple activity to assess for multiple domains.
Ini berikutnya adalah video yang akan kita amati bagaimana seorang guru menyampaikan apa yang bisa dilakukan di beberapa domain. Tugas, so what we gonna do? We just listen to it?
For now, yes.
Yeah.
So the idea is to understand that to assess for all of these domains, you don't need a lot of fancy tools. You can use any of the activities and the tools and the toys that are already available to you or to the child.
Di video ini akan digambarkan bahwa untuk melakukan assessment fungsional nggak perlu alat yang kompleks, tapi alat sehari-hari, permainan sehari-hari yang ada.
And you will see, even though we've talked about the domains all individually, that when you do an activity, you can combine them and look for multiple domains in one activity.
Dan bisa juga pemahaman kita di berbagai domain itu hasil kumpulan dari berbagai pengamatan atau beberapa kesempatan melihat. Jadi setelah terkumpul dijadikan satu rekaman profil.
So you can watch this video and Margarita will interpret it and then we will talk about it together afterwards.
Oke. Kita nonton dulu, lihat apa yang menarik, nanti akan kita diskusikan lebih lanjut.
There we go.
They create moments.
All right, you ready?
Here is our body. They create moments of joyful.
It's already full of it. I'll just have to keep quiet so we can all hear.
No, ini udah HDMI soalnya.
Oh,
Karena audio juga masuk kan ke HDMI ya kalau nggak salah.
yeah. You ready?
Bubbles really are magical. They create moments of joyful communication with your child. My name's Nat, and making big bubbles is my special sauce. If your child uses a communication device, click it nearby. You can use it to find the word or the phrase that you're using. You can use an ALS map to build on your child's communication.
Oke, ini Ibu Guru Nat yang akan menunjukkan beberapa cara yang bisa dilakukan untuk melihat fungsi anak. Pertama, menggunakan gelembung. Gelembung itu ternyata mudah dipakai dan bisa melihat kemampuan interaksi anak. Berikutnya dia menunjuk ke kertas itu namanya ALS, Aided Language Stimulation, di mana di situ di dalamnya ada kata dan visualnya, ya, yang bisa diajarkan, bisa mengajarkan anak kata-kata, ya, vocabularies-nya, jadi perbenaran kata dan cara penggunaan kata-kata itu untuk menyusun kalimat. Ya, misalkan di ILS-nya ada tulisan gelembung, bubble, tunjuk di ILS-nya. Ya. Dengan gelembung bisa banyak kata yang dipelajarin tadi ya. Misalkan dalam membentuk kalimat, kita ajari anak menunjuk bubble, lalu minta tambah bubble, atau mau bikin dua konsep di dalam satu kalimat. Tambah gelembung besar, tambah gelembung besar. Dengan ALS ada alat bantu visual, melihat gelembung itu akan lebih mudah dipahami anak. Di luar juga ketika bermain, bisa kata kerja kita pelajari menggunakan gelembung. Misalkan gelembung diberikan ditepuk, tusuk, injak, ya hanya menggunakan satu alat gelembung. Apakah bisa dipahami? Ya.
Okay, so that was an example of a very simple activity that we can all do where you're assessing for a range of domains. So in that video you would have seen, and Marguerite was interpreting as we went, we looked at assessing communication, both expressive and receptive.
Oke. Ternyata tadi itu menggunakan itu kita juga bisa melihat ketika misalnya injak, anak ngerti nggak injak? Nah itu artinya kita juga memprofil kemampuan komunikasi reseptifnya. Atau ketika anak menunjuk gelembung, berarti expressive communication-nya. Hanya dengan gelembung kita bisa melihat beberapa domain fungsi anak.
So in expressive communication, she was commenting on the activity that they were doing. So she was talking about the bubbles. She was looking at expanding the language. So going from a simple one word piece of information. So just saying bubbles, so that could be requesting or commenting, to more bubbles and extending it further to more big bubbles.
Ya, di situ juga kita lihat bagaimana yang disebut commenting, memberikan komentar menggunakan ALS. Jadi ketika melihat gelembung, anak bisa jawab gelembung, itu adalah komentarnya, responnya. Dan juga anak bisa minta satu tambah gelembung atau tambah gelembung besar, itu adalah bentuk komentar atau merespon dari gelembung yang dia lihat.
And then with receptive language, she was having a look at, does the child respond, or can the child respond to simple instructions? So pop, clap, stomp.
Ya, dari situ kita selain melihat kemampuan ekspresif, komunikasi ekspresif, sebenarnya dengan gelembung tadi, guru juga bisa melihat bagaimana anak reseptif, memahami ketika disuruh injak, tusuk, tepuk si gelembungnya.
And she also discussed within that the motor skills that she could assess for. So looking at whether a child can point, because if they can pop the bubble with their index finger, that's an assessment of whether they can point. And she was also having a look at if they've got coordination to clap their hands together. So you can clap a bubble and having a look at that coordination. So it's a really fun way of assessing some skills in an activity that the child is enjoying.
Ya, dengan gelembung guru bisa melihat anak bisa menunjuk gelembung apa enggak. Itu kan komunikasi. Atau koordinasi motoriknya bisa menepuk gelembung apa enggak. Jadi koordinasi mata dan tangannya jalan atau enggak. Hanya dengan kegiatan sederhana yang disukai anak, kita bisa dapat berbagai informasi di multiple domain.
So we're going to have a practice.
Nah, kita akan latihan.
Okay.
Yes.
What we'll do is we have some bubbles here. What I would like is for a volunteer to come up, and we're going to have a practice. Grace has very kindly offered to be a child.
Ya, jadi kita akan berlatih, minta satu relawan. Ini yang jadi anaknya nanti adalah Grace. Siap.
And we would like a volunteer to pretend to be a parent or a teacher, and you can interact with Grace using bubbles. And we would like to see how you go with including different domains. It might be the same ones as what we saw in the video. It can also be different ones.
Ya, satu relawan diminta untuk menjadi orang tua atau guru. Silahkan maju, nanti coba berinteraksi dengan anak Grace dan menggunakan kesempatan interaksi itu untuk mengumpulkan informasi fungsional di beberapa domain. Bisa domain yang tadi atau domain baru.
Wonderful. And this is just for fun. Okay?
Santai aja, ini kita bermain sambil belajar. Bapak ini bilang injak. Ya, bisa kelihatan sebagian ya. Ya. Tusuk. Grace merespon dengan menusuk. This is a very nice child. Too nice. Yeah. Nah. Oke. Oke, tiup ya. Yeah. Can I be the child? Grace is nice child. I can be the bad child. Not bad. Can I be the child? Yeah. I'd be scared.
Yay, but she's now seen the bubbles. Thank you very much. Great acting skills.
Yeah.
So can you comment on what you saw?
Ya, apa yang Anda saja barusan lihat dengan anak Grace dan anak Reta? Ya Pak.
What did we assess for?
Ya, anak Reta sangat kooperatif. Oh sorry, anak Grace, kebalik. Anak Grace sangat kooperatif. Mau mengikuti instruksi.
Reseptifnya seperti apa?
Reseptifnya bagus. Dia bisa memahami perintah. Satu kata. Banyak perintah bisa diikuti, hampir semuanya. Cuma di akhir-akhir tadi ada beberapa yang salah. Kemudian anak Reta menunjukkan perilaku yang dia stimulasi diri dengan melakukan aktivitas yang berulang dan ketika dipanggil tidak memberi respon, diulang-ulang, apalagi dari belakang. Artinya komunikasinya, reseptifnya dia boleh jadi tidak memahami atau tidak mau mengikuti panggilan. Belum bisa dipastikan apakah tidak memahami panggilan atau tidak mau mengikuti panggilan. Kemudian ketika pindah posisi, mencoba berhadapan, saya kira itu posisi yang sangat bagus, mencoba untuk membuat kontak mata, dan ada respon yang lebih baik, lebih positif responnya. Mau melihat gelembung, itu satu respon yang saya kira menjadi pintu awal untuk komunikasi.
Tadi bapaknya bilang ke saya, "Tiup." Apa yang dilakukan?
Melakukan sesuatu. Boleh jadi tidak memahami perintah. Yap, oke, cukup ya.
Thank you, kita aplaus untuk Pak Hasan. So he explained most of that.
Right.
So with Grace because she was able to respond to respond all the command, the verbs that shows Grace receptive ability and understanding of the words. And while Margreta, as the child, she shows interest on herself, self-stimulating behavior. And it took eye contact approach from the teacher to make her make contact. But they also noticed that there is this poor receptive ability because when the teachers say blow, what Reta did is smashing. Ya, gitu, apalagi ada yang miss nggak? Ya pasti banyak.
I think
Yeah, some more or less like
I
that.
think
Yeah.
that those comments were great because it got the whole purpose of the whole exercise. Basically, you did the functional assessment. Yeah, great.
Itulah yang namanya assessment fungsional. Yeah.
And one of the really important components of what we saw there was building a relationship and getting each other's attention and being a good play partner. Because if we can't get a child's attention, we really can't actually assess for their skills.
Dan tadi kita melihat betapa pentingnya membuat kontak dengan anak. Kita mau ngajarin dia, kita mau melayani kesehatan dia. Tanpa kontak, interaksi, tidak akan terjadi apa-apa.
Excellent. Do we have any comments from the
Ada lagi yang mau kasih komentar?
Was
Oh.
was that easy? Was that difficult?
Gampang apa enggak?
Volunteer.
Iya.
Komen yang tadi kan ya Bu ya. Baik, kalau yang terlihat dari perbedaannya dari Grace sama Bu Reta, kalau untuk komunikasi seperti yang Pak Hasan tadi sampaikan kaitannya dengan kontak mata, kalau Bu Reta belum dapat, si Grace sudah dapat, kemampuan imitasi. Jadi kemampuan imitasi itu Grace sudah dapat tetapi Bu Reta belum. Kalau joint attention juga sama, Bu Retanya belum, Grace sudah gitu ya. Kemudian kemampuan untuk meraih perhatian di komunikasi dasar itu antara keduanya memang berbeda. Kalau secara komunikasi, secara reseptif juga mampu mengikuti perintah satu tahap untuk Grace, Bu Reta masih belum. Kalau secara kemampuan ekspresif tadi belum muncul dari kedua peraga tadi.
What she notices the differences between child. Well, Grace has the ability to
Belum.
make eye contact, joint attention, imitate behavior, and making expressive of herself by some of the gesture. While Margareta, she hasn't had that eye contact, making joint attention, which actually influence the difference of behavior.
I think the other really, I think that's a really good point that you make because it wasn't only assessing communication, receptive and expressive and gross and fine motor. It was also basically assessing social. And I think that's the point you were making, that the social responsiveness of the child.
Ya, betul sekali yang disampaikan oleh Bu Iin bahwa tadi bukan hanya sekedar domain komunikasi yang tampak, tapi interaksi sosial, kemampuan interaksi.
And I think what the activity shows, right, there are many activities that you can assess the same things in. You know, you can be at a simple fruit time activity, you know, having fruit time with the child, having a snack with the child. They can be in the playground. But I think the reason why Kate went through the domains this morning in such detail, now that I'm thinking in domains, I'm thinking gross motor, fine motor, social, receptive communication, expressive communication. Now I'm taking all of that and I'm applying it to a very simple activity. So it's not complex, but because I understand the domains, I can now apply it to all sorts of very small activities.
Ya, banyak aktivitas yang bisa dilakukan, bukan cuma main gelembung, bisa makan bersama teman gitu ya. Dan yang penting buat kita pahami, domain yang sudah detail kita pelajari, ini jadi kerangka berpikir ketika kita mengamati anak. Ambil satu aktivitas kegiatan yang natural saja, tapi kita udah tahu, oh ini komunikasinya, oh ini sosialnya, oh ini motornya. Kita udah berpikir dalam domain-domain. Kita jadi lebih cepat mengamati dan mengetahui apa kebutuhan anak.
So often when a family will come into our early intervention center and they'll see a therapist with bubbles, they'll say, that's not therapy. I can play with bubbles, right? But basically what you have to explain to the family is I'm using that activity to look at where the child is at on terms of all those developmental domains so that I can now build a strategy to extend areas of each of those domains.
Ya, kadang-kadang orang tua mikir, ngapain terapi pakai gelembung, bayar mahal-mahal gitu ya. Tapi dengan kita berpikir secara domain, alat berpikir kita ini bisa digunakan bahwa dengan gelembung saya bisa mengetahui kebutuhan anak, lalu saya bisa merancang intervensi yang tepat buat anak, dan orang tua bisa kita berikan pemahaman supaya dia tahu bahwa yang kita lakukan ini ada dampaknya pada anak.
I just wanted to draw our attention to one more domain, and you might have explained it, but I didn't get that around the cognitive functions. So the difference in attention span between Grace, so she was able to attend through the whole activity. She was we assessed that she could understand the communication, understand those instructions, but she also was able to attend, and she chose to follow the instructions as well. So that was quite different to Margareta, who didn't have the attention span to be able to attend to that activity for a very long time.
Ya. Selain yang disampaikan Bu Iin, tadi sebenarnya juga ada komponen kemampuan belajar ya, terutama dalam atensi konsentrasi. Grace tadi bisa bertahan lama main sama gurunya, sedangkan Margareta nggak bisa. Mungkin attention span-nya pendek atau masih harus dibantu.
Okay, so it's 12:30. We will break for lunch now. This afternoon, we will come back and we will watch another video. It's a longer video, about 6 minutes. And I would like for all of you to look at all of the different domains that are being assessed during the activity. So I'll introduce it after lunch, and we'll have a practice for all of us to use the domains for assessment, and then we'll finish off the functional assessment component and go into translating the assessment for programming.
Oke, berikutnya nanti habis lunch kita nonton video agak lama. Tugas kita adalah mengamati domain apa saja yang muncul di dalam video tersebut yang berharga untuk functional assessment. Nanti akan dilanjutkan dengan
30 minutes for lunch?
30 minutes for lunch. 30 menit. Oh, sama sholat. 45 minutes they say. Because they will need to pray, some of them will pray. 45 menit ya Ibu Bapak.
Ya, ya.
Silakan.